We apologize for being late. We had some business we had to tend to, but I wanted to call the meeting to order. Someone say something?
There's no exception. I mean, we're following rules, but it's cool. Go ahead. I'll give you a pass this time.
Thank you. I appreciate that. So we were dealing with some issues in the back, and we needed to do that. So I do apologize for the delay. I want to, go over the rules and inform everyone once again. We'd ask that everyone that wants to participate in the meeting, we ask that you extend the same courtesy and respect to others that you yourself would expect in return. We have a number of people who have indicated that they would like to speak. The one requirement we do have is that you need to give an address. There are a number of people who did not do so, so if you know that you didn't provide an address when you intend to speak, I'm going to give you an opportunity to come up and provide your address. So that's the one requirement that we have. So anyone who intends to speak, you need to do an address. If you do not provide an address, you won't be able to speak.
You want us to do that now?
Please, if you don't mind. And so that was the one thing. The other thing is we ask that everyone treat each other with respect. There's no profanity, no swearing, no yelling. If you do engage in those behaviors, we will ask you to leave. With that being said, beautiful baby, beautiful. Let's start with roll call. Well, you know what, maybe we'll wait a second and give everyone an opportunity to put their address down. And again, public comments will be limited to 3 minutes per comment. There are 3 sheets.
I gotta just put the. Is that okay? Is that okay?
I can't read it, so just the street is fine. Street in the neighborhood's okay. I don't know what sheet you'd sign, but Mary Dimmick. Okay. We know her address. We're okay. I thought you said. So. She wants her pen. So with that being said, we'll start with roll call. Judge Lazara.
Present.
County Controller O'Connor.
Here.
Terry Klein.
Here.
Richard Fitzgerald.
Steve Polarski for Rich Fitzgerald.
Sheriff Kevin Kraus.
Jack Kearney for Sheriff Kevin Kraus.
Gail Moss.
Present.
Abbas Kamara. Pat Katina.
Bethany Hallam here.
Thank you.
I object, Your Honor, to
That's
Actually,
not,
I'm going to object to Mr. Polarski voting illegally as a designee under the statute that is not allowed.
okay. So what
I got it, babe.
So what
Thank
we
you,
don't
though.
do is we don't just have public outbursts. That's not what we do here, okay? All right, well, I'm trying. All right.
I'm here to make sure you do.
Okay, but while you're doing that, I need you to make sure the meeting is orderly and done with respect. Outbursts will not be tolerated. Thank you. With that being said, we'll start with the community corrections. Passages to recovery.
Good afternoon. Kevin Cordsley with Passages to Recovery. A couple of things to report. We've restarted, gone through all of the policies, got them approved with the county jail to restart our in-house visits and also to start community-based visits with family members. Met with all the clients last week. handed out the procedures, have also started with them submitting passes to do the community visits, and clients are starting to turn in the paperwork that we need to do the in-house visits. Working with PA Women's Work to expand their services into case management services, employment services with our clients. They provide services to both women and men. Working with Goodwill to bring in a fatherhood program into the agency, and recently completed our annual scheduled audit with alternative housing. So that is pretty much all I've got.
How many, I missed it if you said so, but how many people do you have in your program at the current time?
Currently, we are 95% capacity, so I've got 38 in residential and 7 in transitional living.
All right. Yes, ma'am.
Hi. So I've been getting a lot of calls lately from people in Passages who have been talking about instances where on the weekends they are having to prepare the food for everyone in the facility. Can you please talk about that? Is that normal? Is that planned? Why is that happening?
It's unusual. We had a cook that was working on weekends but was out on disability, and so we had people volunteer to help with that on the weekends. She recently returned to work this past Monday, so that has been resolved.
Okay, and were there instances where outside food had to be brought in? How were meals being prepared when there wasn't a cook?
There were a couple of situations where the food that was present, either they didn't like it or weren't interested in doing it or weren't willing to prepare it. So we did have, we did purchase food from the outside. Some clients had kind of paid for that and they were reimbursed for it.
Okay, so I'm sorry, who paid the money for it and then was reimbursed?
Some of the clients had I think it was specifically for a holiday. I think it was the 4th of July, so this was several months ago. And they had gone with staff to purchase some food because they didn't put specific food for the holiday and they wanted to celebrate. So they were taken out to the store and the receipts were saved and they were reimbursed for anything that they covered.
Okay, thank you. And how many instances would you say that there have been, at least, since you've been around, that there was no one to prepare food and other measures had to be followed?
I would say there was just that one situation, but typically we've been lucky enough to have clients that were willing to volunteer for community service hours.
Oh, wait, so I'm confused. So it was only one time that there was no cook? I thought somebody...
No, that there was no one to help prepare. There were either with clients volunteering or having a staff person on staff.
But there's supposed to be a staff person to prepare food all the time?
That is our goal, but like I said, we had one of our weekend person was out on disability, and she's recently returned this past Monday.
Right, I understand that. That was that's what I was trying to get at. The question was, how many times was there not a staff person prepare food?
I think that with that we had about 2 months to where she was on disability, and we had to rely on clients to volunteer to help prepare food.
Okay, thank you very much.
Any additional questions? Thank you very much, sir. Now hear from the Renewal Center.
Good afternoon, Adam Zach reporting for the Renewal Center. Once again, we participated in the annual Pittsburgh Recovery Walk. I'm pleased to say we had 15 staff members and 85 reentrants participate this year. And also our employment numbers for the month of September, we're up to 74% employer employment for our eligible reentrants.
Any questions? Ms. Klein?
Any COVID positive residents?
I don't have the numbers right now. I know I don't believe we had any positives for the month of September. It's slowing down, thankfully.
Any additional questions? Thank you, sir.
Thank you.
We'll now hear from electronic monitoring.
Thank you, Your Honor. Good evening, Board. Steve Eswine for the Probation Office. Nothing new outside of our report, just some highlights. We had 636 individuals enrolled at the end of the month, and 58 were successfully completed. And we had actually one person on the CyberLink device through mental health court. So that's all. Any questions?
Any questions? Thank you very much,
Thank you.
sir. With that, we'll now hear from the warden for the warden's report.
Good afternoon, Board. Good afternoon, everybody. The first thing I would like to talk about is education at the Allegheny County Jail. Through our partnership with the Allegheny Immediate Unit, high school classes resume at the jail school facility on September the 14th. We are excited to hold classes again in our school, rather than on the pods where our teachers have instructed students since the beginning of the pandemic to follow CDC mitigation practices. 7 individuals graduated in June, and we were unable to hold a traditional ceremony like we did prior to the pandemic. Each individual posed for a photo with their cap and gown and diploma. We have also resumed in-person instruction for our adult education programs. 5 individuals have passed the GED exam and received their diplomas since we resumed testing in April. 1 individual who passed had been working with the program since 2017. Voting at the Allegheny County Jail. This year, the county added a video to the tablets and to the pod television explaining individuals' voting rights, how to register, and if already registered, how to request an absentee ballot. In 2022, incarcerated individuals voted in the primary and general elections, as well as the special election. Reentry services. Amy Kroll, our director, is always looking to add new trainings and opportunities for our incarcerated population. In August, she brought trainers to certify some of our individuals in the renovation, repair, and painting. As we reported then, all 11 that signed up for the program completed them and were certified. This month, we can report that all 11 individuals also completed the lead abatement training and have been certified in that discipline. These sorts of training and certification help us prepare individuals for good paying jobs when they are released. We want to equip those in our custody with the skills that they need so that when they're released, they never return. Training programs like this are an integral part of that process. Chaplaincy. Several chaplains who work for our partner, Foundation of Hope, recently attended the Pennsylvania Prison Chaplains Association Conference. The theme of this conference was addiction and recovery in a correctional setting. We are also welcoming a new director for the Foundation pre-release program inside the jail next week. Discharge and Release Center. The Discharge and Release Center continues to assess between 200 and 400 people monthly prior to being released. The program ensures individuals have resources and referrals they need before they are released to the street. The top referrals continue to be food assistance, the Hope Aftercare Program, and the Allegheny Health Network River Clinic. Books. As previously reported to the JOB, when books are delivered here, the jail requires a receipt for inventory purposes. Books delivered without receipts are returned to the sender. Most books that are returned are due to lack of receipts. However, we are proactively adding dozens of books that was returned to our e-library, including John Lewis graphic novels, March and Run, and several other Lewis books and biographies. Facilities. In September, staff members noticed a significant number of spotted lantern flies outside the employee entrance. The jail reported it to the Department of Agriculture and notified facilities. The number of invasive insects in the area has dropped significantly in the recent weeks. Safety and security. On August the 25th, the jail conducted a routine canine search with local law enforcement to check for contraband. This is a normal part of security operations that had not been performed since the beginning of the pandemic. It is an important training exercise for both outside agencies and our staff as we seek to keep our employees and our incarcerated individuals safe. Training. Training for autism screening began at the jail on October the 4th. The jail has partnered with the Autism Connection in Pennsylvania to provide 6 in-person training sessions during the next 2 weeks for approximately 180 employees. Those who do not attend the in-person training will attend training virtually. There was also a question from the board pertaining to an update on who signs intake documents for female and non-binary juveniles. And what I would like to report to the board, that anybody that comes to our facility, a magistrate judge signs the documents for everybody that enters our facility. Your Honor, that's all I have for the ward's report.
Any questions? Ms. Hallam?
Thank you. So I want to start with the books since you mentioned those. I was looking over the policy about the sending books to incarcerated individuals, and I noticed that in the official jail policy, it says that books are accepted by USPS, UPS, or FedEx, yet I noticed on the jail's website and from practice and you talking here that actually we're only now accepting them from USPS. Did that change, and why did the policy not get updated?
I'm going to have to look into that part of the policy, but we do accept them as long as they're being provided through those 2 vendors. So we have not, 3 vendors, I apologize. No, 2 vendors, Christian Books and Barnes & Nobles. So as far as how they come to the facility, we have not rejected any books based on the mechanism in which they came. So I will look into the disparity between the policy and what is posted on our website and rectify.
Okay, please do that. Also, I have heard that Barnes & Noble is routinely not sending a physical receipt with books, and that's actually leading to a bunch of books being banned, even if maybe the specific titles aren't banned. So it's seeming, at least to people who are incarcerated and their loved ones, that the only way they can get books right now is through christianbooks.com.
So we have contacted Barnes & Nobles. We did speak with them and open up a complaint. We have verified that the 2 warehouses for which the books are distributed from, Monroe, New Jersey and Reno, Nevada, all books shipped from these locations are supposed to be coming with receipts. We also have been documenting the tracking slips that come from the vendors to identify what location they are coming from, and we have identified that books coming from both Monroe and Nevada are not coming with receipts, hence the complaint that we have lodged with Barnes & Nobles, and we're working with them to rectify. If other books are coming from other locations that are not those 2, we are looking and trying to remedy that with Barnes & Nobles.
So is a solution to get rid of the physical receipt requirement? Because that's what it sounds like to me.
We're working with the vendor to identify the best action forward. We're also working with our mailroom to identify the best practice moving forward as well.
Okay, but so in the meantime, right now, because people have had books rejected and have not gotten their money back because of an error or a miscommunication between the jail and Barnes & Noble, and I'm wondering what we're doing to remedy that right now.
It's not a miscommunication with the jail and Barnes & Noble. Like I stated, we contacted Barnes & Noble. They stated that all books that come from the 2 locations are supposed to have receipts. We notified them that that is not occurring, and they've started, based on our filing of the complaint, looking into those 2 locations where we did not getting receipts. One of the issues at hand is that we don't have order numbers, so it's taking much longer to investigate this issue since we only have the tracking numbers. They don't identify order numbers.
So aren't you able to use the tracking number to identify the sender and accept it without the order number? Why?
Through my interactions with Barnes & Nobles, if we don't have the order number, and that's not for us, it only has the tracking number and identifies the location in which the the label was created. So the person ordering it orders it, the place that generates the label creates the tracking number. So they might be able to do it, but what we have access to, we don't have that information.
Okay, so then I will ask again, what are we doing in the meantime to remedy this situation?
So as the warden stated, one of the things that we are doing is we are adding every single book that we possibly can that meets the policy to our ebook library. So we are taking those books, we are documenting them, and we are immediately purchasing them through the ebook. So at least they're available through that mechanism. So that is the one step that we are doing currently. And again, we are working with our administrative services, the mailroom, as well as the vendors to help remedy this issue, as well as find out different ways in which we can have book providers get books to the jail was meeting our policy and procedures, specifically an inventory receipt for us to verify.
Okay, so is there a reason why we're no longer accepting books from publishers and it's only barnesandnoble.com and actually right now only christianbooks.com?
They are the two locations which have centralized warehouses for which they distribute and package those books. So again, we are looking and we are evaluating everything to find a best possible solution and a pathway forward.
So are you claiming that no other book publishers have central warehouses?
Nope, that is not what I'm claiming. Those are just the two that we are currently using. And again, I'm stating that we are looking at other options as a pathway forward. So everything's on the table for us to evaluate and investigate and find the best solution forward.
So a big glaring problem here is that not everyone in the jail has access to ebooks. So how are they getting access to books if your solution is ebooks?
So we also have our carts of books that are located on every pod. We also have libraries within the pod itself. Those are rotated amongst the pods and amongst the levels. So, and we also have our central library, which we can utilize for restocking. They can also make requests to Chaplaincy if they're asking for specific types of religious books. They can also make requests through the tablet.
They don't have a tablet, the people I'm talking about. People who do not have access to a tablet.
So could you be specific as to pod locations, or could you provide that in specifics to those individuals? Because
a variety of reasons. They have broken a tablet in the past. They owe money for doing some sort of damage to any item at the jail. Mental health diagnoses, being on lockdown, being on a pod that specifically forbids the use of tablets, being classified to a mental health tier that specifically forbids the use of tablets. I can think of multiple instances. I'm wondering what is the general solution for all of those instances.
We do still have some paper requests that come through, so I will look into whether or not they are utilizing that as a mechanism on those pods or in those locations for those instances.
Okay, and so you referenced these libraries that are on each pod. Can you speak to the number of books and the condition of the books that are in those libraries? Because I've been to the pods and I have never seen a library.
So they are carts, they're library carts that are located on the pods. There's roughly around 100 books that we place on the carts themselves. As to the conditions, you know, when they are damaged, we do remove them. If they are in poor condition, we try to make that circulation, but they go through, you know, use and everything. So as they're identified, they're pulled and replaced.
So I just want to be clear, are you claiming right now that every pod has 100 books on a cart? I'm saying that there are carts available for every pod. I'm not saying that there are 100 books. When we establish the carts, there are about 100 books that they can hold in capacity. Depending on the size of the book, it may be less. So the cart is able to hold 100 books, not there are 100 books on the cart like you stated earlier. Okay, thank you very much. I have one more question as pertains to books. So according to policy number 430, publications 4, the date of the policy is April 14th of 2020. The policy is titled Inmate Mail Privileges and Publications. There is a part of that policy, the jail's own policy, that states that any time a book is rejected for any reason, that both the sender of the book and the incarcerated individual that was the intended recipient would receive a notification that the book was rejected and why it was rejected. Can you speak to what that notification looks like and ensure me that they are indeed providing notification to both parties every time?
That is something we have engaged because, again, we have the mailroom staff who handles that. That is outside of, they're under administrative staffing, so we are working with them to resolve the issue where there's a miscommunication. It is being documented of what the reason is, and we're trying to resolve the issue of where we have lost that distribution of information.
So are you agreeing that right now that policy is not being followed? There's not notification being made to both parties?
I'm saying there's documentation of it, and I'm saying that we are working to resolve the issue.
Okay, but are both the sender and the incarcerated individual, according to your own policy, receiving notification?
I could not speak to that this moment in time.
Can you provide me a sample of what that notification looks like?
As we work through the process, I'll be happy to share that.
Okay, thank you.
Halsey, would you like me to send that to you, or would you like it distributed to the board as a whole?
All of us, please.
All right, thank you.
Okay, another question regarding, and I don't see this anywhere on the agenda, so I just figured now was probably the time to bring it up. We had heard talk last time about the reimagining the jail RFP. Can you give us an update on what that looks like, what's happening with it?
So that RFP was issued through the Department of Human Services, so we could not speak to that.
But it's reimagining the jail, and Yans are the jail.
They're the ones who are heading that. They're the ones who are engaging that vendor. So at this time, we would have to direct all those questions to DHS, who's the one who is owning that contract and that process.
So at this point, there's no collaboration between DHS and the jail regarding the reimagining the jail RFP?
Besides the identification of a vendor right now, I think that they're still in discussions with that vendor. But correct, at this time, we do not have any information to share on that topic.
So a vendor has been chosen, but no contract has been entered into yet? Is that the status?
Again, we are not the ones who are handling that. We are also not the ones that handle contracts. We would have to defer that to purchasing as far as the status of the contract, as well as defer to DHS in regards to the specificities in the contract.
Okay, is there a reason that they are not here then to speak to that, if that's somebody that we need to talk to find out about something going on with the jail?
That is something that you would have to direct to DHS. They are not employed by the jail.
Thank you.
Any additional questions? Ms. Klein?
I was curious why there were no in-person contact visits in your juvenile pod in the report.
Currently, we don't have any in contact, meaning individuals coming into the facility.
Structured family contact visits. In the report, there were no juvenile contact.
We'll have to look into that. We have contactless visits. The jail is open to visits, contactless. So, but we'll have to look into as it regards to juveniles being visited with.
I was just surprised that there were no visits to in contact visits to juveniles.
Yep, we'll look into it.
Thank you. Just briefly on the follow-up on the books, the rejected books, I think we asked this last time, or maybe we sent an email. And I know you have to respond to the individuals and that, but can we get a copy of the reasons some books over the last few months, if not a year, have been rejected? I think that's part of the policy too, but not just the individuals get it, but why certain books have been rejected. And then since we're on the warden's report, I know staffing we're going to discuss, but I know that we are engaged in the audit. You guys got your letter of intent, so we're going to be starting that process from our office. But I do have just a question for staffing. So what do we provide for the mental health for the employees? Is there sort of like a policy? Do they get to meet with someone? I mean, they have tough jobs down there, but is there something provided to them? And if that's later on, I'm sorry, I'm asking, is that in your report? Should I ask that question later?
No.
That is not in my report.
It's not in your report. Okay, well, that's a question. If we could just
We have an
get
employee
some
assistance program. If anybody reaches out, we'll put them in contact with outside.
a mental health specialist
Correct.
for the employees, but they have to do the reach out, and that's through that process.
Yes.
Okay.
Can I ask for clarification in regards to your inquiry, the books and the reasons? You want more than the reasons listed on the county website? You want specific?
I would just like the specific books. I mean, I know, and if it's on the website, I'm sorry, I haven't seen it, but just if you rejected a certain book, the reasoning for that, I believe that's supposed to be in writing.
You want the book title and
The title, yeah, just so we can have that, yeah.
Judge Halsey, to you or to the entire board? Would you?
Oh, I would do the board. Oh, sorry, Judge.
To
Sorry,
the
Judge.
entire board,
Sorry,
please.
Judge.
Thank you.
Sorry, Judge.
No problem. Ms. Moss?
There's been so much said about the books. I'm getting off on what I wanted to say. Yeah, the warden mentioned in his report, he names specific books that were returned, I believe. Is that correct, when he gave his report?
There was a specific book that he listed, yes.
Yes,
John
okay.
Lewis book.
Now, what happens, and it might have been said, but there's been a lot said about the books. What happens to that group of books that you sent back? Will they be returned, or will whoever sent them be notified? Because some of those titles seem to be very good books. I think that was worth reading. So will there be some way that we can retrieve the books back for the inmates?
So it's
Or the
returned to-
residents, I'm sorry.
It's returned to sender, is how the,
So there's no way, if you know whether they'll be returned here?
to the facility, you mean?
Yes, after.
No, because the books, they are returned to sender is what is put on the book, on the
So the people that sent the books,
Yeah.
you have no way to, we can't notify them to let them know that it has to be sent a certain way, or how do they find out what happened to their books?
That information is on the website, but as far as when they come to the facility, we just return it to sender. We return it based on the packaging, and that's how the administrative service.
So they're just gone?
Yeah. We do, again, they are
We need a
documented.
better system than that.
They are documented in OMSC as the books and the reasons why they're rejected. So in that regard, we do have that documentation.
So are you able to maybe retrieve them somewhere else, some of those titles or some of those books, those authors?
Yes. And like I mentioned, those books that are returned without a receipt, we make every effort to add them to our library. So we do have those added to our catalog, and we do have it documented in our system as to what books are returned and the reason why they're returned.
Okay, thank you.
Ms. Hallam?
Thank you, Judge Halsey. I just wanted to clarify something just for you. First, Ms. Moss, that's what I was actually asking about. The jail's policy says that they need to notify the sender of the book and the incarcerated individual of the reason the book was rejected, and that is not happening. And I've spoken with a lot of people. I can't say that this is every single instance, but in most of the cases of books being rejected, the person who sent them does not receive the book back, and they do not receive their money back. The jail has explained that that's a Barnes & Noble issue, that Barnes & Noble is responsible for the refund, but those refunds are currently not happening. So people are buying books, they're getting rejected, they're not even being notified of why they were rejected, and then they're out the money. So I just wanted to clarify that. And then also a question to alley-oop off of Controller O'Connor. I was speaking with someone earlier who was, through a simple Google, found out that the PADOC actually provides a list online of every book that is rejected and why, because you're right, that is a problem. There is no list online that says these books have been rejected, this is why they've been rejected. So if I'm going to send, a John Lewis book to someone who's incarcerated, I don't know that I'm not allowed to do that. I don't know that that book has been rejected. So, and again, all the other titles have been rejected. So I'm wondering why that list already exists, because I know you had told us someone from the jail had told us at a prior meeting that there is no list of rejection reasons being kept, and now I'm hearing the exact opposite. Why has something changed? Did you start keeping track of that? And if so, why is it not made public to prevent people from wasting their money on sending books that are not going to be accepted?
So again, the books themselves are not, it is the manner in which they are received. So if we get a shipment that does not have a receipt, and like we discussed, we are looking into it, we are working with Barnes & Noble to resolve this issue, we don't even know who the sender is because there is only a tracking number on that documentation. So to your point of notifying someone who sends the book, we can't notify anybody because that receipt is not there, that information is not present, not even the order number. So we don't have someone to notify except to return to sender, which is Barnes & Noble's. So in regards to your reasons for the lists, that is something that we can look into, but the books themselves, for the majority of the books, are not rejected because of the book itself. It is rejected because of the process in which the book is received.
But there are books that are rejected because of content, correct?
There are books that are rejected because they are received as a hardback book, which is clearly stated on our website that we cannot receive them as a hardback. They have a spiral binding. And then, yes, there are some books that have imagery that is not accepted for the facility, and those we can look into and, like you said, refer back to the PADOC and their procedure for posting.
Okay, and this list that you now have of books that are being rejected, this is new? Because it was only a few months ago that you told me that list did not exist.
So when we don't have a list, we document it within our system. So as to the reason why they are being rejected, I stand corrected. We are keeping the receipts of the books for the ones that we are getting off of ebooks. So we do physically have just started that process in probably the last couple of months. So those we do have a maintained list of.
And can you provide that to the board, each of us, please?
They were not rejected because they were the books. So once we purchased them onto the library, they're now part of our library as far as the entire catalog.
Okay, I'm not sure if I'm not being clear. I am looking for the list of books that were rejected due to content.
Okay, and that is something that, because it is content, that is not part of the purchasing part of the process, but that is something I can look into.
Yeah, I'm not really concerned what part of the process it is. We had asked for this months ago, and we were told it didn't exist. And then you had said that the reason you can't notify the sender is because if it doesn't come with a packing slip, then how do you know who to notify? But I would imagine on the label it says who the incarcerated individual is. Are you notifying them each and every time a book that's sent to them is rejected?
Again, we're looking at the process. It is documented in the system, and we are working with the individuals who handle that end of it to close the loop.
So is that no?
We are still working with that department, and we're trying to resolve that issue.
So yes or no? Do you notify incarcerated individuals when books are trying to be sent to them and not and rejected?
At this current time, I can't speak specifics to that process.
Any additional questions? Warden?
Your Honor, that's all I have for the warden's report, sir.
Chief Beetson?
Thank you, Your Honor. Good afternoon, Board. I'm going to begin my report today by addressing a number of issues that were raised from the last meeting. The first being that incarcerated individuals receive immediate medical attention at their request at no cost, and a determination to provide care not be left to correctional staff. The ACJ medical care is administered through its contract provider, the Allegheny Health Network, and supplemented by non-provider medical staff employed by the county. Medical emergencies have a response time of 4 minutes or less. Individuals are either treated and remain on the pod or are transferred to the jail's medical housing unit. If an individual is assessed as needing further treatment, they are sent out to the hospital. For routine medical care during the time frame of the survey, wait time was 8 days. The second issue was that incarcerated individuals be given the ability to add, delete, or modify emergency contact information at their request during all stages of incarceration and custody, and that this request be processed within 1 day of the ask. Currently, incarcerated individuals are permitted to change their emergency contact information through the tablets at any time. This change was made several months ago. This is handled by our caseworkers who receive the tablet request from the individual and update the emergency contact information. Our records department acts as a backup to this process. The third issue from last time was that the Allegheny County Jail must notify the emergency contact and the Jail Oversight Board with complete details around the incarcerated individual's medical emergency, hospitalization, or death within 2 hours of the event. So the jail does reach out to the emergency contact when advised by the attending physicians. In those instances, the jail can make a request to the courts to release an individual from custody so that family or friends can visit without obtaining a court order, but this decision is made by the courts, not by the jail. The fourth issue was that family members or listed emergency contacts be allowed immediate access to a hospitalized incarcerated individual. Again, there are safety and security issues when an incarcerated individual is hospitalized. Individuals must be released from custody or receive a court order to have visitors in the hospital. Both of those decisions are made by the courts. And then the fifth issue from the last meeting was that transparency into the medical records of deceased incarcerated individuals. The jail can and will release those medical records when the legally designated representative submits the proper paperwork from the courts. Moving on to an update for incarcerated individuals waiting for transfer upstate. Current 300 Bs in the facility are 42 males, 0 females. I have 3 males that have 300 Bs with open detainers, 4 males with open cases. Updated on a padded cell installation. A contract extension was completed by county purchasing. The vendor's home office and warehouses were affected by the recent hurricane in Florida. They're out of Fort Myers. So we have no current timetable on when they can resume work, okay? So we still have 7 of the 10 suicide-resistant cells completed. I have an update regarding the juvenile education officer vacancy. I believe you asked about that, Ms. Howell, last meeting? Okay.
But I would love to know about it.
So there was some confusion as to whether it was referring to the officer that works on the juvenile housing unit or the officer that's assigned to the classroom that supervises that portion of the jail when they're down in school. So
I'll take both.
okay. So the officer that was working on 5MC, this isn't a bidded position. So whoever has seniority and that's their preference, that's where they're assigned. That particular officer changed his preference and moved to a different post within the jail. The classroom down on level 1, so at the time, movement in the facility for programming was halted because of COVID mitigation efforts. So there was no juveniles going down to that area. AIU was sending teachers to the housing unit to complete education processes. That has since resumed, so the juveniles are going down to the classrooms, and we have an officer stationed in that area. Does that answer what you were looking for? Okay. Due to Allegheny County community COVID levels being low, the jail relaxed its mask mandate to be optional with the exception of certain areas within the facility. This was 3 days ago on Monday. So the particular inmate or areas of the facility that are still under a masking mandate are our intake department, our intake housing units, meaning 4A, 4B, and 1C, any and all medical healthcare interactions with incarcerated individuals, and anywhere that we have positive COVID cases within the facility. We're going to monitor for a period of time and evaluate based on case count when to resume full recreation. We are still conducting split recreation. Next, I'd like to provide a report on staffing. We're frequently asked about staffing at the ACJ, and we typically respond that we prefer to address such questions in an executive session as opposed to a public forum. That's because our top concern of the facility is safety and security of the incarcerated individuals and the staff members, and we can't discuss specific issues in public without jeopardizing both safety and security. While we are already providing information to the Jail Oversight Board regarding staffing vacancies, we will work to provide more robust statistics moving forward. If there are follow-up questions or requests for additional information, we will do our best to address those at the following meeting or to discuss in an executive session should the chair wish to call one for that purpose. The jail is currently funded for 487 full-time corrections officers, and we currently employ 374, which means we have filled 77% of the corrections officers' positions. In short, we are appropriately staffed to maintain the safety and security of the jail. However, that does require overtime from the current corrections officers and a big reason why we continue to push our recruiting efforts. To put those numbers in perspective, we also looked at our 10-year average to see how our current staffing compares to previous years. The yearly average over the past decade is 411 corrections officers. That means we are down 37 or 9% from the 10-year average. But it's also important to note that this is not unique to us. Correctional facilities nationwide are facing similar staffing issues. The average population of the ACJ has dropped significantly over the past years, meaning pressure to fill every position is somewhat lessened. For example, in the last 3 months before the pandemic, specifically December of 2019 and January and February of 2020, we had an average daily population of 2,710. Over the past 3 months, June through August of 2022, the daily population is 1,624. That's a 41% decrease in average daily jail population compared to a staffing level that is currently 9% below the 10-year average. When daily staffing issues arise, it's not because of vacancies, but because of call-offs or for other reasons for unavailability. On average, we have about 32 corrections officers a day who are unavailable due to leave, compensatory time, suspensions, etc. And we average about 22 call-offs per day. These are staffing issues that we and other correctional facilities face every day. We continue to focus on recruiting efforts and ongoing morale-boosting campaigns. We continue to move more recruits through the academy. 15 were sworn in last month, and currently we have a new class of 9 cadets started training on September 12th. We do intend to further bolster our numbers because the more staff we have, the more we can expand our rehabilitative and educational services, which benefits everyone. We have run continuous academies and commit to continuing that process moving forward. That's all I have, Your Honor.
All right, good evening, everyone. So I did add a couple of things to my report this evening. I first wanted to address a recent news article related to one of our practitioners and questions of his licensure. In the interest of transparency, that's why I wanted to address that here in this forum. Dr. Bernales is not the jail's employee, he is an employee of AHN. When this issue was brought to our attention, we contacted AHN and asked for this to be addressed and for replacement physicians. AHN is responsible for verifying credentials and licensures for the providers that they hire, and Dr. Bernales was licensed to practice in Pennsylvania. I have come to trust the work and the team that AHN has always produced for us and will continue to do so. Our part of the recruitment process is limited to security clearances, being able to get them associated to the jail, whereas AHN is doing that credentialing part. We interview the potential providers and perform background checks that are related to their criminal histories. So I just wanted to touch on that a little bit. Chief stole some of my thunder about the mask adjustments with the mask mandate, so I'll skip right over that. Other related COVID information. For infection rates and testing, the total amount of incarcerated individuals tested for COVID-19 during September was 1,825. Of those, 34, or 1.9%, were found to be positive. There are 7 incarcerated individuals presently positive in the facility, with 0 hospitalized. And actually, when I pulled that number, I realized that one of those persons was not actually positive. They refused their test, so that's why they're in isolation. So it's really only 6 positives. For employees, throughout the pandemic, we've had 319 staff report positive results, and we presently have 1 individual who continues their recovery process and not yet returned to work. For vaccination, last month we reported we had 697 individuals receive their full series. This month we've had 592, or 42% of our incarcerated individuals that have a full series of vaccination. For medications for opioid use disorder and the expansion of those efforts, our continuation of medication-assisted treatment includes, for the month of September, 13 individuals prescribed oral naltrexone, with 1 receiving the Vivitrol injection prior to release. During September, 112 individuals were treated with Suboxone and 13 treated with Sublocade. I also wanted to provide a more detailed update on our progress in expanding MOUD services related specifically to methadone treatment and the continuation with our partner Tediso. I understand it may be believed by some that it's taken a very long time to put this in place. This specific form of medication-assisted treatment has many complexities in and of itself, and then when you add that into a correctional facility, particularly one that operates 24/7, there are additional complexities such as rolling admissions. So over the months, we have built infrastructure to provide the new service to include staffing, training, procedures that hadn't existed before, technical issues in terms of our electronic health records, our record, as well as Tediso's record, and trying to get through firewalls. A lot of tech stuff I don't understand, and I'm sorry. Regulatory requirements related to the federal regulations, continuity of care to be able to get the information we need from community providers, as well to continue their medication, but then also to get information back to the community when someone would be ready for release. 7-day-a-week services, in terms of how we would operate to do continuation, is very different than a regular methadone clinic that wouldn't be doing admissions on the weekends, whereas we would because of rolling admissions. And then some of our specialty populations, being able to see if there were going to be changes, particularly with pregnant females, or if we needed to continue with some of the new processes. So those are some of the complexities I just wanted to talk a little bit about. We do have a few final outstanding tasks to close the whole loop, and it should be hopefully completed in the near future. Based on our estimations, the expansion will serve approximately 20 to 50 patients per month. Ultimately, the addition of methadone services will increase our medication-assisted treatments to enrollments. We're going to be increasing about 5 to 7% of our population when you work out those numbers to the total that we would have. So for Torrance, during the month of September, 5 patients were admitted and transferred to Torrance State Hospital. 9 patients were committed to Torrance State Hospital. Currently, 16 are awaiting their admission to the hospital, with the longest waiting since June 10th of 22. As we've previously talked about adding the rescission rates in terms of those who were reevaluated and found that they would not need to be committed to Torrance, there were 3 in September. Regarding tiers 4 and 5 within our mental health units, tier 5, as a reminder, includes patients actively suicidal or self-harming. So in the month of September, we had 1 of those individuals in a tier 5 in our mental health tier system. Tier 4, which includes patients at imminent risk, so not actively harming, of self-harm, suicidal, or homicidal ideation. So we had 23 of those individuals identified as tier 4 throughout the month of September. Regarding our appointment wait queues, volumes of appointments, and then the wait time, for sick call requests for medical, again, these are the first time appointments, the first time that they've made a medical complaint. We've currently 59 with the longest waiting 6 days. And on average, we see about 70 to 90 a day. So you can see we're pretty current with that rate. For SCR, sick call requests, mental health, again, first appointment for mental health staff, 5 appointments are in our queue with the longest waiting 1 day. For psychiatrists, we have 115 with the longest waiting 10 days, which is one of the best rates that I've seen in quite some time. And then mental health specialists, which is a follow-up appointment, not a first appointment, would be 4 with the longest waiting for 3 days. These statistics are on par with what we used to see prior to the pandemic, prior to having significant staffing issues. And I'm pretty proud of my people, so I just wanted to put that out there.
I'm sorry, can you just repeat the psychiatrist number?
115, waiting for 10 days. Can you put that in the microphone for me?
It's better than Mercy Behavioral's doing.
Thank you.
Anything else?
One last thing, a little bit of new business, just I wanted to make sure that the board was aware of this before you learn from the news or anything like that. In August, our healthcare department issued a pilot program assembling interdisciplinary treatment team for one of our housing levels. We were just piloting this. And initial findings demonstrated significant success, and we're going to be expanding that pilot throughout the rest of the facility. So it was some really good news from our healthcare team.
Ms. Allen. Thank you very much. Ms. Allen.
Yeah, I have a couple questions. I guess I'll work with the most recent thing you said. So I appreciate the numbers about people waiting for sick calls and stuff, but how many sick calls were submitted that they were never seen or treated?
I'm not sure I understand what you mean.
From talking to individuals incarcerated, I hear, I submitted a sick call and nothing happens. Not as much like I was waiting and it took this many days to see a doctor, but I never saw anyone, or I never got treated for my ailment.
So the queues that I mentioned, like the sick call request for medical, that having 59 with the longest waiting 6 days currently, They are not completed unless they saw somebody.
Okay.
So it would only be 59 who've not yet been seen currently.
So there's never an instance where somebody submits a sick call and is not seen or
Not
treated as a
never.
result? Okay. My second question is about, I appreciate the MOU update every month, but like, girl, I have been on this board for like going on 3 years now, and I've been being told every single month it's coming. I very, very much understand that methadone, and I mean, it is a complex thing, but like, we're already giving it to a specific population in the jail. So like the issue of like trying to figure out weekends and all that stuff, we're already figuring that out. I've been waiting for 3 years, and everyone else in the jail has been waiting a lot longer than I've just been on this board.
I can appreciate that, and that's why I wanted to go through some of the details of it. Those people that we are currently serving, much smaller volume. So when you're increasing to a different size volume, there are more procedures that need put in place because of the amount of both staff involved, protocols involved, and things like that. So if we were treating 50 people, I can't transport 50 people once a week like we are with some of our people who are currently receiving services.
So every person that's receiving methadone currently is going outside of the facility to receive it?
Not daily,
Right.
but for their follow-ups, and then they get their take-homes. And the take-homes come back to us and we administer.
So is there any methadone induction happening right now?
Oh, no. Well,
Zero.
Let me correct myself. Should somebody come to the facility pregnant and we see that they are using some form of an opiate for safety of the baby, we do convert, but we don't do the conversion. West Penn does that. So when they first come in, they get a pregnancy test, the drug test. We find out that both of those two things are present. They're going to transfer back to West Penn, get converted, and then come back to us. Then we transition them to Tediso for ongoing.
And what percentage of the jail population have you identified would be eligible for induction of methadone if it were available tomorrow?
20 to 50 per month, individual separate, or not individual separate, 20 to 50 unique patients.
So 20 to 50 patients, not percent?
Correct.
Okay, and how many people are on methadone now? I think you said.
I think I might have 2, but I may have had a couple released. I'm not sure if they're still in the facility.
So we're not talking hundreds of people here?
We're not, but in terms of transportation, that's a big question mark. And that's why that's taken so long.
Sorry. So what is the specific hangup, like, again, I've been hearing this every month, it's coming, like, when we had a previous deputy warden, I was hearing it's coming every single month, and I'm just wondering, can you give me an estimate that like, hey, Bethany, don't be pissed till February, or, like, can you give me an estimate, like a realistic time?
I would really love to. We had a potential go live date, and then there were issues that came up and we couldn't even use it. I really want to be able to give you guys a go live date.
Are we close?
We are really close.
Like super close, like coming.
We're super close.
I'm gonna see it in my lifetime.
I hope to God you do.
Okay, I would very, very much appreciate that.
Yes.
Okay, and then I think thank you. I think my next couple questions are for Deputy Warden Beeson. So my first one is, one of the things I didn't see in our documentation is the solitary report for October. Like usually, like we get the month before how many people were locked in solitary.
That comes out in the report that's issued on the 5th, isn't it?
Right, but I didn't see it online. I didn't see it to us. Has anyone else seen it? And I'm the only one missing it online or here? No, it's not out. And today's, I'm pretty sure, the 6th.
Okay, we'll have to look into that.
Okay, and then my second thing is, I know I was asking about the reimagining the jail, but I actually was like scanning the crowd and I see that the director of DHS is here. So since you said that DHS is the one who's able to answer the questions, I was wondering if the board has any objections to us hearing from Ms. Dalton an update on the reimagining the jail RFP, because we were promised last meeting that we'd get an update today, and
Ms. Hallam, that's not fair to Ms. Dalton. It wasn't on the agenda. No one knew about it, nor did she. So I don't think it's fair to put her on the spot. Hopefully she'll have some information for a subsequent meeting.
Can we ask her if she minds?
I think I just addressed that. Thank you.
But do you agree that last month we were promised an update this month?
No, we weren't promised an update. She said she would get information as soon as possible in the future. Bottom line, it's not on the agenda. Hopefully in the next meeting she'll have something. Thank you.
Why are you doing this, dude? I don't have anything else. I'm just wondering why we're not getting things that we were promised at previous meetings.
Any other questions? Mr. O'Connor?
Yeah. So quickly, the warden mentioned education has resumed in classrooms. So I know from the survey and the conversation we had last month are now, religious services, AA meetings, are those now in groups as well? I know now that you're opening up education classes.
Those are still happening on the housing units because we still have, we're still on a split recreation schedule, so we have not resumed those in the.
Okay, and then.
If I could, you did mention AA specifically, so I just wanted to, we're trying to get AA back on site.
Back on site, okay.
Yeah, we weren't able to do any kind of remote or anything with them, so they've been on pause throughout the pandemic.
Right, and then, I just thought if education's coming back, those are services much needed as well, if they can meet together. And then, I guess, 2 follow-ups. So the use of force numbers, I don't know if Ms. Hallam meant this or not, but do we get those statistics each month? I know we mentioned it in August. I don't.
Mr. O'Connor, that's my fault. I don't have that information. I will make sure that I get that information to the board by tomorrow.
Okay, thank you very much. And then last on recruitment, obviously seeing numbers, we know we're going to look further into it. Can you just provide us with what you're doing for recruitment?
Sure.
You may have mentioned it before.
We're still advertising using social media or platforms like Indeed. I literally have administrators on a virtual job fair right now back at the jail trying to bolster our numbers. We've run 9 physical agility sessions over the past 2 weeks. And like I stated, we're continuing the academy process. We usually have a week or 2 break in between, and then we're bringing them back in as fast as we can.
Okay, thank you.
We also got the list of applicants that applied to other jobs of similar nature in the county, specifically the Sheriff's Office, ACP, and we sent them letters, basically cold calling them via the mail to see if they were interested in applying and looking at the jail to apply. So we're using other resources within the county to try to.
So if they applied there, you would sort of streamline who's applied at those other facilities, and you would reach out. Okay.
Ms. Moss?
Can we get, I know before the school was out in the spring, I had looked at the curriculum that was going on. Is there a way that maybe the board or the participants, people that are here, can know what type of classes we have? Is there some way that we could have something printed or either put on the web or something?
We can follow up with the Allegheny Intermediate Unit to see if that can be provided for
yes,
this month.
For the ages that are there, what kind of education they're receiving in their age brackets that are.
Yes, ma'am.
Okay, thanks.
Ms. Hallam?
Yeah, for Deputy Warden Beeson, I'm just sitting here talking about staffing. So is there a direct correlation between the number of people incarcerated and the number of staff needed at the jail?
You mean as far as how many budgeted positions we have?
No, what I'm saying is, does a lower population in the jail lead to a fewer officers needed to staff the jail?
No, I was just putting that into perspective to compare the last 10 years population versus the amount of corrections officers that we had. So we have a certain amount of posts that we have to fill every day. So based on call-offs or mandatory overtime refusals, sometimes we have to collapse some of those positions, but.
So, would the staff at the jail appreciate a reduction in population? Like, would it make staffing easier, since it's obviously we're having a hard time getting officers, retaining officers, and medical staff, and mental health staff? I'm just, trying to brainstorm. I know this is an ongoing problem. It's been brought up meeting after meeting after meeting. We're trying to hire people and we can't. So I'm just wondering if the officers at the jail, for their own safety, would appreciate a lower jail population, if it would have an effect on the number of positions needed.
I'm sure they would appreciate more corrections officers more than anything, so.
Right, but let's say if the population of the jail was half of what it is now, would we need 50% fewer officers? I'm just wondering what that correlation is.
I couldn't make a correlating percentage that we would need, but if the population went down, we could probably close more housing units, meaning we would need less officers in those areas that we could redeploy somewhere else.
Okay, thank you very much.
Sure.
Any additional questions? Thank you very much.
Your Honor, with the board's permission, I would like to present our findings to the PIT survey if approved by the board.
Yes, please.
Yes, you may, Warden.
So the first thing I would like to say to the board is that we welcome this survey, and we already began working on solutions to some of the survey results. We've also put our response out to the public in a press release so that the public can see what our response is, and we also send it to the board. So we're going to start off with Chief Deputy Warden Beeson pertaining to the basic needs. Chief?
So under basic needs, the jail does provide basic items to the incarcerated individuals at the facility. We were somewhat surprised to see the results that suggested that residents of the jail overwhelmingly report purchasing items from the commissary that are considered necessities. While this may be a matter of personal preference regarding types or brands of basic hygiene items, we will continue to gather information on those purchases. With that data, we can determine whether there are adjustments that could or should be made to what is provided. As a starting point during the intake process, all individuals receive 2 undershirts, 2 pairs of socks, 2 pairs of underwear, 2 jail uniforms, 1 towel, 1 pair of sandals, 1 pair of tennis shoes, and 1 hygiene kit that contains a toothbrush, toothpaste, deodorant, soap, shampoo, and shaving cream. Toilet paper and razors are available on the housing units at no cost to the individuals. The jail also maintains an inventory of soap, toothpaste, toothbrushes, and deodorant on all pods, which are restocked on a weekly and monthly schedule. If a pod runs low on any items, the supply department will send additional items to meet that request. Additional hygiene options are also available for purchase from the commissary. Through a review earlier this year, it was determined that a wider variety and supply of feminine hygiene products were needed. The expanded inventory of items is available at no cost to the incarcerated individual and are available during the intake process and always available on the female housing units. This concern was also brought up by the Jail Oversight Board earlier this year, and we were happy to report at that meeting that we had already altered our purchasing to address this need. This is just a small example of how we are using input provided from a variety of sources to make informed decisions about the facility.
Regarding the medical care, ACJ Medical Care is administered through its contracted provider, Allegheny Health Network, and supplemented by non-provider medical staff employed by the county or contracted through agency services. ACJ incarcerated individuals have in-house access to dialysis, dental, x-ray, radiology, physical therapy, optometry, orthopedic, OBGYN, wound care, clinic, and laboratory services. If an individual needs additional medical care beyond what is provided in-house, we coordinate that with AHN, I apologize. Medical emergencies have a response time, like Chief mentioned earlier, of 4 minutes or less. Individuals are either treated on the housing unit, transferred to the medical unit, or sent out to the hospital if the assessment indicates that's what is necessary. For routine medical care during the time frame in which the survey was conducted, 88 people had wait times for their first appointments, were awaiting their first appointments, and the wait time for that was about 8 days. As of October 4th, which is when we prepared all of this, and then I have newer information I presented earlier, there were 41 sick calls, with the longest being 8 days, so we've even improved the wait time from there. There are also currently 9 dental sick calls with a wait time of 3 days. Unfortunately, many come to the jail with severe dental neglect. Dental was specifically highlighted in the survey. The Allegheny County Jail will share the concerns, and I have already started doing that, raised within the survey with our partners about dental hygiene and care. These providers should use dental extraction only when clinically necessary and where no other options are possible. Medications prescribed by qualified medical personnel are provided to incarcerated individuals at no cost, including ibuprofen, acetaminophen, other over-the-counters, along with all of the other patient-specific. It's pretty broad formulary. These and other over-the-counters as well as are also available on commissary if not prescribed. We acknowledge sometimes medications are not passed at the designated time. There are many contributing factors other than staffing, including patients not being available. They could be at court or not reporting or refusing the medication outright. The jail is aware of the issue and continues to work with our medical partners to address that. We'd also like to clarify that when this does occur, the medical department prioritizes and ensures delivery of prescribed medications to the incarcerated individuals, as it does for all medical decisions. These decisions are never made by correctional staff.
Under the section of comfort, but specifically temperature and sleep quality, perceptions about the temperature of a room or facility are variable across populations. It's typical for some people to be cold while other people are too warm. It is especially difficult to regulate temperature across a building of the age, size, and composition of the Allegheny County Jail. When temperature concerns are raised, the jail does take temperature readings and responds accordingly. And while some residents of the jail report being too cold to sleep, the jail provides t-shirts, socks, jail uniforms, and 2 blankets to keep residents warm. Additional items are available for purchase in the commissary. However, based on the survey results, a review is being done to determine whether additional basic items should be provided. The Allegheny County Jail has advised medical staff of the survey results related to the timing of passing of sleep medications.
For the section on food, Summit Food Services LLC is the provider of meals to incarcerated individuals at the Allegheny County Jail. In response to a review of the food program in early 2020, the caloric intake was increased by 400 calories or 14% to 3,200 calories a day. It has and will continue to remain at that level. Previously, individuals were provided 3 meals a day of 2,800 calories, which is the national standard. The 3,200 calorie content does not include additional nutritional supplements like those ordered by medical for pregnant women or individuals with other special medical needs. Meals are selected from a menu created by the vendor's dietitian and are designed to meet the recommended dietary allowances and caloric intake requirements and include fruit at breakfast. Like with most county contracts, the ACG food vendor is selected, awarded, and contracted through a competitive bidding process. Under the current contract, incarcerated individuals are provided a daily diet that meets nutritional requirements as determined by the vendor dietitian. As noted, individuals receive 3 meals a day. The medical department will notify food services in writing of any inmate whose medical condition requires a special diet, and that individual will be offered an alternative meal that meets those dietary requirements. Alternative meals are also available for individuals whose religious beliefs require a special diet. The Chaplains Department will notify food services in writing about any inmate requiring special religious diet. The jail's current contract with Summit expires at the end of 2022. The meal service and commissary results for proposals are both out and will be awarded prior to the end of the year. The ACJ contracts with Fort Pitt exterminators for pest control services with kitchen facilities treated twice per week. Just like any other food facility, the kitchen is inspected regularly by Health Department, and ACJ leadership has requested additional inspections when warranted. Staff has been instructed to increase monitoring of food lines to ensure that meals meet expected standards. Cleaning and sanitation practices have been enhanced through emphasizing expectations and improving communication with exterminating vendor, the food vendor, and with correctional employees assigned to the kitchen.
Regarding mental health that was surveyed, of those participating in the survey, 50% of men, 40% of women reported having symptoms that would indicate mental illness. This is consistent with national trends that show high rates of mental health issues for people in jail. It stands to reason the safety precautions taken to protect people from COVID would exacerbate those feelings of isolation, depression, and anxiety. Comments suggest that being in a cell for long periods, necessitated by public health concerns, was hard on residents. While necessary during COVID, the county moved as fast as was safe out of lockdown and back to normal operations. The county is committed to providing mental health services to people while in jail, and when a lockdown is not required, programming is provided to support people and reduce social isolation.
Tablet program. The tablet program began in October 2020. The program provides numerous educational and entertainment opportunities and enables incarcerated individuals to maintain regular contact with loved ones through the purchase of video visitation. Additionally, beginning at the start of the pandemic, the jail also provided a free daily phone call up to 10 minutes and continues to do so. Survey results show that the county's investment in tablets is yielding positive results. More than 94% of people answering the survey indicated daily use of the tablets, and 71% said they use the tablets to contact family and friends while in jail. 49% of those surveyed indicated they were able to contact family and friends every day or almost every day. The Allegheny County Jail leadership will continue to look to build on the use of the tablets to increase engagement in programming, education, and work readiness programs. Incarcerated individuals have access to numerous free programs, services, and other contacts, including but not limited to educational programs including resume building, calming and medication guidance, jail-specific resources including the handbook, commissary ordering, requests and grievances, and other related to electronics or other informational items, prison Rape Elimination Act information, and reporting of other crimes or concerns resources including ebooks and a law library. Incarcerated individuals also have the option to purchase content including movies, television shows, sports, music, games, and more.
From the survey under exercise, the survey results showed dissatisfaction, particularly among female respondents, with the amount of exercise they were participating in. This is not surprising given the public health need for separation, which resulted in lockdown and other protective measures which impacted and continues to impact out-of-cell time. Since the survey was taken, recreation has changed to split recreation, then back to full recreation, before moving back to split recreation after another spike in COVID cases. The jail seeks to provide incarcerated individuals as much out-of-cell time as possible while also providing a safe environment that minimizes spread during the pandemic. Individuals have access to cards, games, books, tablets, and television on the pod in the common areas and basketball in the pod gym during their recreation time. And they are also able to walk and perform other exercises on the housing units.
Reading, ACJ introduced its ebook program in 2021 and now offers a library with nearly over 700 ebooks and audiobooks. The jail takes into consideration suggestions from the incarcerated population and requests into account when it curates its ebook offering. The jail also maintains a library of 20,000 physical paperback books that are rotated in and off the housing units. The jail continues to build its ebook options.
Treatment by staff. The jail expects incarcerated individuals to be treated with dignity and respect by all staff at the facility. Correctional officer training includes courses of interpersonal communication and verbal de-escalation, suicide prevention and intervention, and mental health first aid. These courses include empathy as a key component. Individuals can report complaints and grievances in person, in writing, or through the tablets. Correctional officers and staff who witness incidents where individuals are not treated in accordance to policy are required to report that interaction. Captains and sergeants are responsible for reporting those reports and addressing any issues raised on the levels in which they are assigned.
Under showers. Showers are available 7 days per week on the general housing units. During mitigation efforts, individuals had the option to shower every day during their recreation time. At minimum, individuals are required to shower 3 times per week, but are able to shower more frequently, even daily, on the general population housing units. Individuals in the disciplinary housing are to shower at least 3 times per week based on the posted shower schedule. All individuals are provided a hygiene kit when committed to the facility, and soap is available on the pod. Individuals can also purchase additional items from commissary if there is preference for a different brand.
Your Honor, we are finished with our response to the PIT survey.
Ms. Hallam.
I do not have questions. Thank you very much. Okay. So first of all, I was very interested to read the list of things that are provided to every person in the jail, because when I went for a visit a couple weeks ago, which I'll be reporting on later under new business, I specifically asked because they were all wearing orange open-toed sandals, and one young man had sneakers on, and I asked him if he was provided those, and every single person said to me that they only get orange sandals, open-toed, like neon orange sandals. So can you please speak to your report that says that they get both sandals and tennis shoes?
So the jail does provide on the intake pod. They're not provided at intake. The orange sandals are provided when an individual comes into the facility. When they go to the intake pod, that is where those are housed and provided to them. They're Velcroed sandals, and some individuals do prefer not to take those and keep with the orange sandals.
But I'm sorry, in your list of things that everyone gets, you put sandals and tennis shoes.
They are offered both. Whether or not they take them is their choice.
And then can they get them at any time? Or is it only if I don't want 2 pairs of shoes at intake, I'm stuck with one my whole stay?
They are provided them at the time of intake.
So they're provided 2 pairs of shoes, and I specifically asked many people there, and there was like one person who had the Velcro sneakers on, and he bought them on commissary.
They also do offer them on commissary, but they also are provided on the housing units when they're intake.
But if you're giving them to everyone, why would they need to buy them on commissary?
Some individuals, may prefer the option that's on commissary.
They'd prefer to pay for them instead of get them for free?
They are available on they are available on the intake pod.
Okay.
Wait, hold up, Ms. Hallam. Excuse me, if we could just keep our comments to ourselves. It's disruptive, other people can't hear, and it's impolite. Thank you.
But Judge Housley, I do believe that we're being lied to based off of the testimony of many, many incarcerated individuals. Are we going to do anything about that? That is a question. Okay, the second one is, can you describe what the toothbrush that is provided is like? Is it a regular toothbrush that I'd brush my teeth with at home?
We have 2 types of toothbrush. We've actually phased into a different one. The hygiene pack comes with a long-handled brush, and then we have one that we are now storing on the pod that has a short nub handle.
Okay, so you get both when you go in the jail?
You are provided the one in your hygiene pack, and then there are toothbrushes that are available on the pod. We had the long-handled one, and then we are converting to a short nub handle.
Okay, yeah, because the way that somebody described them to me is like a finger condom toothbrush. Do you happen to have one that you can show us?
I absolutely do have one that I
Thank you. I was hoping that you did.
Not that I really understand the finger condom description.
Where's that coming from?
But I kind of do.
Yeah.
Some of our mental health ones look differently.
Okay.
So that might be where that description comes
And is that what it looks like, a finger condom?
Do you ever see those ones for babies that you can slide your finger into? That's what they look like.
That's what they are. Okay.
So we have short nub,
Can you show everyone the little toothbrushes that we give people?
short nub, and toothbrush.
Okay, cool, thank you. And then 2 blankets. This was another thing that I specifically asked everyone was regarding blankets. I have never seen anyone with 2 blankets at the jail. Can someone speak to what those blankets look like and why I've only ever seen anyone with 1?
They're provided with 2 suicide prevention blankets. Those are the bifold blankets. So they might be inside each other when you're looking, but they have 2.
Okay. The next question is, so a lot of people in the survey complained about medical attention, lack of medical attention, not getting their medication, not getting their insulin. I know you said like we're addressing nighttime meds not coming at the right time, but I want to specifically ask, how does one go about requesting medical attention?
So there's a couple of mechanisms. There is a way to submit a sick call on the tablets. They can always utilize the call buttons to, if there's something more urgent that they can't wait for, so that they can get in touch with the officer and the officer can contact us also. Those are the 2 primary ways. They can also talk with the med nurse if they're going up to see the med nurse.
And how does one ensure, if they are requesting medical attention via the call button, that their request for medical attention is actually recorded as a sick call?
So when we get those calls from the officers, they typically come to our medical housing unit, and the medical staff that are there are the ones responding to those calls. So it's not getting entered as a it's not entered into the same queue, so to speak, but then the medical people are addressing it in the moment.
So the numbers that we get about sick calls does not include people who hit the button and requested medical attention?
Right, those are the self-identified through the tablet numbers. those coming through an officer call are handled in the moment, so they're not documented that way.
Okay.
Not everybody has a tablet.
So what record does one have to track their sick call if they don't have a tablet, or if they do have a tablet but choose for maybe a more sense of urgency to use the call button? Like, how do I make sure that my sick call actually went through, that my request for medical attention is actually happening?
Because it's verbal, I don't have a documentation mechanism.
Yeah. No, I know that. I just wanted to hear you say that. Yeah. Because that's my concern, is that we're not actually getting a clear picture of how many people are requesting medical attention. I'm worried that I understand the sick call numbers that we're getting, but I wanted to be clear that there are requests for medical attention outside of the formal sick call process that we're not getting reported on.
So that formal process is for non-emergent ones.
Right.
So that's why there's socially acceptable that it's waiting for the next day or something like that. Whereas those other ones that are going through the call button are urgent ones. So that's kind of why it's not documented in the same way.
But there's a lot of people who don't have tablets.
So the areas that don't have tablets, you mentioned earlier with Deputy Toma, you indicated, I believe if I remember correctly, restricted housing, people who lost their tablets, right?
Broke them, owe money.
Okay. So restricted housing, there are healthcare staff there every day to be able to round and screen for any kind of deterioration because of segregation. So that's the easiest way to access healthcare from that mechanism. And then I think you mentioned also mental health patients as well. So those pods would have healthcare staff throughout the day available to be able to talk with those people.
Okay, but that, again, not recorded in the sick call numbers and wait times that we get?
No, it goes straight into like a progress note or something separate, so it's not within the same mechanism.
Okay, thank you very much about that. I mean, this is kind of like aside, but I also talked to a guy not that long ago who said that he had his tablet banned when he was in the jail before. He came back a year later and he's still not allowed to have access to the tablet. So are there people outside of those categories that we just referenced that also don't have access to the tablets to submit sick calls?
You're saying somebody was banned from a tablet, was released and brought back in?
Yeah, they were banned. They were in the jail a year ago. They were banned from the tablet a year ago. They came back recently, and they still are not allowed to get a tablet.
Was it because of abusing a tablet? Do you have information that I can get, that I can look into it?
Yeah, I can give you his name after the meeting if you can look into that. I would really appreciate it.
Thank you.
Thank you very, very much. Okay, so I'm trying to solve this problem of people that keep dying in the jail, okay? So 17 people since April 2020. Most recently, Anthony Tallada died a couple weeks ago. And so I'm going to assume, and again, stop me if I'm wrong, but that these are emergent medical issues, that they're not being able to report via sick calls because you're saying the emergency ones are via the button?
It's not limited to that being the only way that they have access. So when it becomes an emergency situation, if an officer happens to observe something, they can immediately call a medical emergency. And that's where we're talking about in some of these summaries that we're responding within 4 minutes.
Okay, and what if an officer refuses to call in for medical help?
I'm not able to speak to that. Would you be able to?
They have an obligation to report that.
And if they don't, what is the recourse for the incarcerated individual?
If we become aware of it, there will be an investigation, and then the proper steps would be taken.
So like a grievance to IA or something like that? Is that what they do? What is my recourse? I'm incarcerated. I keep telling the officer on my pod that I'm having a medical problem, let's say, pain in my legs or a headache that won't go away. And the CO is just ignoring me, saying I'm annoying. I've actually seen instances where they shut off the call box. What recourse do I, as an incarcerated individual, have?
Let me clarify something. We can't turn the call boxes off.
You can't turn the volume down or not like, yeah, because it beeps and it flashes, and then you cannot pick it up.
You're saying if they open it on the control panel and don't acknowledge it.
I'm in my cell, I'm hitting the button, hitting the button, hitting the button, and the CO doesn't acknowledge.
So an individual can file a complaint through the tablets or any staff member when they make their rounds on the housing units.
Okay, so filing a complaint is how you kind of report.
Unless we're aware of it, we can't do anything about it.
Okay. Then another question is, we talked about the commissary RFP. I had heard that it was signed. Can you tell us who the vendor is?
It's not signed. There's no contract. We're in negotiations still, so we can't speak to it.
You're telling me that as of today, no contract was signed?
Correct.
Okay, I'm like really sure that a contract was signed with a 9/30 signature date. So can you tell me who it was? Am I like imagining that happened?
There is no contract that I'm aware of that has been signed.
I think at our Incarcerated Individuals Welfare Fund meeting the other day, we were told it was happening and we would be told at this meeting. Am I making that up? Was anyone else there?
I'm here to see the wizard.
The wonderful Wizard of Oz. Okay.
Due process and other things.
Judge Lazare, anyone else who was there? I remember.
I don't know that it was a specific
I don't think I have it as that it was signed yet.
Okay.
That they were in the process of, that they were negotiating it still, that they were hoping to be able to have it, but hoping is not necessarily always having. Yeah, I don't have it not in my notes that it's signed.
Okay. The other thing is regarding the Allegheny County Health Department. So how many, I don't know who is most fit to answer this, but how many Allegheny County Health Department violations has the jail received in the past year?
That's something we can't answer right now. We have to look into that.
Okay, and you'll bring that number to the next meeting?
Yes, ma'am.
Thank you. And remember, we had voted at a previous meeting that anytime there is an Allegheny County Health Department inspection, we are to be made aware of the findings. We don't have to scour the internet waiting for them. Just wanted to remind you of that, Warden Harper. Next, you had mentioned 700 ebooks were available, but your Twitter guy was tweeting the other day about 20,000 books being available. And so I was assuming that he must have meant ebooks, but you just stated that there were only 700.
Yes, so the ebook library is about 700 plus books, and our physical library is 20,000 of hardback.
Man, where are you hiding those books? Because I have looked every time I've gone. There's not 20,000 books in the jail. Unless there's like a secret closet somewhere. I know you know that.
Do I know where they are?
No, I mean, I know you know there's not 20,000 books in the jail.
We actually catalog them, so we do have that number.
Oh, can we see that catalog?
Yeah, we can, well, no, because it's secure, but we have the catalog. I can't print it. If I can figure out how to export it, sure. It's in a app.
It's in a what?
We use the e-library app to catalog the books.
Man, all right, I'm trying, okay. One other thing about the survey. So I actually didn't know, they've had one free phone call the whole time. That's never went away? One free phone call a day? Because somebody just said that.
Yeah, 10 minutes.
10 minutes every single day, every person, regardless of pod, regardless of tier, regardless of if you're an intake or have been classified and sent upstairs, every single person in the jail?
Every day. That is
The upper
affirmative.
tier-
Yes, ma'am.
The upper tiers will not have phone calls.
So
because of
tiers
this-
4 and 5?
Right.
Okay, gotcha. Okay, I'm sorry, you kind of threw me off guard with this secure book catalog thing, but I think, the only other thing is I know that I have, again, and I will report on this in my visit report under new business, but one of the things that I'm concerned about, and I actually think it ties into the survey results, is that I tell people a lot to write us inter-office mail, in our respective offices, that they don't have to waste the prepaid envelope to get a hold of members of the jail board. I also know that incarcerated individuals use inter-office mail as a way to communicate with their judges or their public defenders or whatever that may be. And every single pod that I visited in my most recent visit had 0 inter-office mail forms. Every single one. I asked the CO on every single pod and no one had one.
when it's brought to my attention that about the interoffice mail, Ms. Hallam, I did meet with my team, and we are going to try to come up with a method as to how we can do the interoffice mail. But the interoffice mail will never be a paper document. So we're going to try to come up with a method as to how we can do it electronically. So we've met with the vendor to see if there's a way in which we can send this electronically. So I will keep you updated at the next meeting.
Yes, Warden, to be clear, that is absolutely the opposite of what I'm asking for. We don't want to make everything electronic. We don't want to make e-books, e-sick calls, e-grievances, e-interoffice mail. Like paper mail, it's very easy. It comes straight to our mailbox. It's paper. It's not any certain type of paper. They just fold it up and write my name on it, and it comes right to my mailbox. Why are you trying to digitize everything, especially when over and over and over again, it's been made clear that not everyone has access to tablets?
The inmates that don't have access to tablets, of course, we will have a paper document in which they can do. But one of the things that we want to do in our jail is make sure that we can be able to track things so that going anywhere. So if an inmate says that they sent an office mail, we want to be able to track whether or not they send it so we can verify it for future references. So there will be a two-process way of doing that: electronically, electronic mail, and people that don't have access to the tablets, a paper system.
Okay, so then the e-submission is irrelevant because I'm talking about the paper forms. So why did none of the pods have them?
And Bethany, I can't answer why none of the pods would have had them, but we certainly get a tremendous amount
Me too.
of things through the interoffice mail. So there is access down there.
Yeah, it's
Because,
just been a while.
I get it every single day.
Me too, and that's why I love it, because it's so easy to get a hold of us. But when I went down there, there was not a single one on any of the pods that I went to. Not one. I asked the COs on every single pod, and they looked where they should be, and there weren't any.
Yeah, it's not a specific envelope. I mean, it'll just be the request.
It's a piece of
written on
paper.
a piece of paper folded and sent to us, and it comes.
Yeah, so these were a specific piece of paper. The ones that I get say interoffice mail and have my name written on them.
We look at those. They write them on the outside again, on the piece of paper, and we get them.
So there are no interoffice mail forms anymore?
We do not have the interoffice mail as of when we went to the tablets in October of 2020.
Why didn't you say that when I just asked?
So we're looking into the process to make sure that we get that process back, Ms. Allen.
Oh my God, okay. That is all that I have about this survey.
Any other questions? Ms. Klein?
Judge Housey, asking to permission to report on the subcommittee, the Incarcerated Individuals Welfare Fund, since we're talking about the PIT survey?
Absolutely.
Okay, thank you. The IIWF subcommittee met to discuss the results of the PIT survey. And just to review, we commissioned the survey to provide us with a needs assessment so that we could be most impactful with spending the fund's monies. We are guided by the principle of doing the most good for the most people. We heard the high levels of dissatisfaction with medical, dental, and mental health care at the ACJ. We believe this is due to staffing issues at the jail, and we, as a committee, did not want to spend money on staffing, as that is the county's responsibility. To that end, we focused on the high cost of commissary, hygiene products, meals, sleep quality, and access to reading materials. We are unable to change the contract with the commissary provider. We talked about, was it possible for us to decrease the commission that we get from commissary? No. So as a committee, we are recommending that we increase the monthly amount put on residents' tablets and commissary accounts to help defray the high cost of commissary. And we encourage ACJ to consider pricing when choosing a new commissary vendor. We are looking at community partners to bring in additional reading material, understanding that it needs to meet the security requirements of the facility. We want to improve the quality of sleep of jail residents and are in discussion with the warden with how we hope to do this. We'd also like to increase the variety of hygiene products available to residents. We are very concerned about the number of residents who go to bed hungry, and we're looking at ways to remedy that. Once we clear our suggestions with the ACJ staff, we will be providing more details. And again, thanks to everyone who participated in this study. And I don't know if there's anything else anyone wants to report from our meeting.
Oh, sorry, go ahead. No, I just had a question. And thank you for doing that. I know the committee, when did we meet, last week or whatever it was? So just briefly on the dietary, and I know the RFP, we'll learn about that hopefully soon, and the pricing and how it's still set up to Summit, which I think is alarming for a lot of us. But what are the guidelines on that? I know that, we have to follow a dietitian provides their input, but in the RFP, are we holding that dietitian to a standard? Like a federal standard, federal guidelines are higher than somebody that could be possibly in that contract. So I know you're in the process of signing that, but I would like to see the standard at which this dietitian is going to follow. If they follow the original standard that was in the last one, from what is being reported, it hasn't gone very well. So, the guidelines and the standards should be to the highest degree. So, when you're looking at a dietitian, they should have to follow the federal guidelines because that's the highest. I'm not asking for that answer now. I just think, if we're still in that negotiation, we would like, or at least I would like to see something a little bit more detailed on what the dietitian has to follow, because whoever gets the award, they can just hire their own dietitian and, everything's great, everybody got 1,000 calories or whatever the number is. But I'm saying, what are the standards? And they should be in that contract that it's at a very high level.
We did explicitly talk about in the RFP what some of those requirements would be that they'll have to follow. So,
well, I know the local, but is there, I'm saying the highest standards possible?
Such as like dietary guidelines based on the American Medical Association. Those kinds of dietary guidelines were included in the RFP.
I know the local ones, or whichever, the American guidelines, but I'm saying I believe the federal nutritional requirements are higher. So if you can just look into that and at least explain to me which ones are higher. I believe federal's higher, but just wanted to get that on. But I think, Terry, thank you for doing that report from our committee. Thank you.
Ms. Hallam?
Yes, so the Controller O'Connor made me think of something again, and I know I would ask the county executive this since he's the one who enters into contracts, but since he doesn't show up, I'm going to ask if anyone can speak to this. So my understanding is that the contract with Summit for the commissary said that they were not allowed to make more than the 10% markup, and that's what Ms. Klein was referencing, is that items were being marked up above 10%, and that's the reason that we're putting the additional funds on their books this month. So I just am wondering why the county didn't cancel the contract for breach of contract as soon as we noticed that Summit was overcharging the incarcerated individuals.
You talking to me?
I'm talking to Rich Fitzgerald, but if you're sitting in his seat.
You don't recognize me.
You're not legally on this board. You are in violation of state statute. Of course I don't.
If you believe that, then why are you asking me a question?
If I'm right, then why are you here?
Hey, folks, let's keep it nice, okay?
Okay.
Please.
I was trying to, Judge Rosera.
There's absolutely no reason for that kind of thing. We're not going to get anything done if that's what this meeting devolves into.
I agree very much, and that's why I was asking a simple question, and I got a very snarky answer.
We're both not going to do that, right?
Okay, so I will rephrase my question. I am interested in why we did not cancel the commissary contract with Summit for breach of contract as soon as we were made aware that they had breached the contract and were charging more than 10% markup on items.
I can't answer that question. I don't know the answer to that question.
Can you please look into it and get back to us in the future? Excuse me?
I didn't know as colleagues we asked each other questions. I mean,
Please be respectful, sir. I'm asking if we could get a response.
Please be respectful.
We would have to probably look at the contract and see what the terms were in terms of when you can actually cancel a contract for breach. It's not that every single term will allow you to cancel a contract for breach. So I'm quite sure that the contract is somewhere, and I'm quite sure that we can have the law department maybe take a look at it and maybe look at it for a determination of when and under what circumstances either side can eliminate the contract without penalty. Because a lot of times when you just decide you're going to say, I'm done with the contract, there's going to be massive penalties involved, and we don't certainly want that.
Right, I agree, Judge Lazara, but I have seen the contract. I thought we all have. And there is a 60-day notice for termination regardless of breach that is in almost all county contracts that we have. And so I'm sure that the 60-day notice is in this one. That's why I'm specifically asking for that answer.
That's why we can probably have the law department take a look at that, because I don't have the contract in front of me and wouldn't have reviewed it for any time recently. So
okay,
maybe that's what the Allegheny County Law Department does. So maybe if they could do that for us, that would be great.
That would be great. That was exactly what I was asking for. So thank you so much.
Anything else?
No, I do want to let everyone know, I mean, the Incarcerated Inmate Welfare Fund is very concerned about the condition. The subcommittee is very concerned about the conditions. That's why we asked for the survey in the first place. It was frustrating to all of us that it took so long, but part of that was COVID. Part of that was, staffing at the pit level. Part of that was we had to have a review. We have information now that we can start moving forward. But everyone needs to understand that it's not going to be immediate. Nothing that is going to happen here is going to be immediate. We're going to try to address the commissary issue, the fact that it's cost so much money. Sir, I'm not answering questions from the floor. So we are going to address the commissary information and being overcharged by trying to add some additional money to the books. That's an immediate thing we can take. The other steps that we have and we have talked about, which include the issues with sleep, the issues with people going to bed hungry, we have ideas for those. We have to, however, look into how much is that going to cost us? Can we do that? What's the process to get that done as quickly as possible? We are working on those things right now. Okay, we promise that we will get things done. That's why we had the survey done, because we are interested in making people's lives better in the Allegheny County Jail. And we promise that we will do that. So we are working on it, but you can't expect that we're going to get this and it's going to be done immediately. It doesn't happen that way, unfortunately. I wish it would. So that's happening. The committee is very engaged and very much working on it and working hard.
I have one more thing to add. Yeah, so, Judge Lazara, with all due respect, I understand people's frustration. We've known about the things that we read in the survey. I mean, I know the rest of the board has for the entire time we've been on the board. So the fact that we just got the results of the survey, I mean, we have to understand people's frustration that we talk a lot about things we're going to fix, and then we never actually see those things fixed, and people are dying as a result.
Ms. Hallam, we all understand that there are issues that need to be addressed, and we're all working on it. And nobody here is unsympathetic, and nobody here is not understanding the frustration of the public. So please don't make sort of an insinuation that we are, because all of us understand the frustration. We all want it to be better, and we are working on it. We're trying to get the jail liaison done, which will improve conditions inside the jail. That's one of the things we've been trying to work on forever. We are now at the end line of that, and I truly believe that that will be a substantial step in improving conditions in the jail, because we will have a person who is independently reporting to this board the conditions all the time, and that's what we're going to do. Where that liaison stands right now is the advertisement is on the county website. For those of you that might be interested in that position, it is on the county website. It's also been posted from the county website to various entities, social media sites that have job requirements. So we are hoping to be able to get some resumes. My understanding is at the time of the IIWF subcommittee meeting, we had received one resume, and one resume only at that point. So I don't know, Mr. O'Connor, if we have any additional resumes that have been received.
So there have been a couple, I know one was dropped off at our office, but the resumes will go to the sheriff's department. So the sheriff, if you submit, HR posted it, it will go to the sheriff, and then from there, we'll work together, because the sheriff's on that subcommittee as well, to get them dispersed to the members of that committee. So that's where it stands now.
As of 2 o'clock this afternoon, 18 people have applied online.
Awesome, that's fantastic. So we're going to start distributing them for the subcommittee to take a look at, and then as we outlined in the process a couple of months ago, we're going to all submit our tops. We will identify who the top candidates are, and then we'll be able to start doing interviews. So, it is coming. Not fast enough for any of us, I get that.
No.
Since we're doing old business, why don't we just complete old business and then we can go back?
Before we move on, though, can I just add one thing? I just wanted to clarify. For the next meeting, we're asking that the county legal team tell us, A, if they believe there was a material breach of contract with Summit, B, any termination clause that is in the contract, and C, the potential for litigation to recoup overcharge, the amount that was overcharged to incarcerated individuals over the amount allowable by contract, to see if we can reimburse the incarcerated individual. Are we going to expect that at the next meeting? I'm just sick of asking for things for the next meeting, them never coming, so I just want to make it really clear what we're asking for the next meeting.
I mean, those sound reasonable. They sound like reasonable requests.
Okay, thank you very much.
If maybe we can get the county legal department to do that, that would be great.
Okay, thank you.
So is there an update regarding the compensation for work performed in the jail?
I actually have really exciting updates on this. So I was finally able, this is my jam. I've been working on this for a while, especially when we were hearing about like passages earlier where they had incarcerated individuals who were serving food for no pay. That happens at the jail every single day. There are over 200 workers, some of them working 8 hours a day, 7 days a week for not a penny an hour. So this is something I care very, very much about. And so I was able to finally get in contact with a gentleman at the DOC who had all of the answers that we needed. He provided me with policies about the laws governing worker pay. He explained to me that there's this system called IOCMS that the Department of Corrections uses to, that's basically like their payroll system. Basically, they make these wages, let's say, you make $10 an hour and you work 10 hours. So they take your $100, they deduct I also talked to the Department of Revenue. We do deduct payroll taxes. Any taxes that you and I would pay, those are income tax, and this is an income they're making. So those taxes are deducted first, and then any amount that is owed for restitution, fines or fees, those things, they do cap the deductions at 25%. So the absolute most that you get deducted from your pay is 25%. He said that each facility has a payroll manager who's responsible for that one facility. So one single staff person does all this. I actually have a scheduled call with somebody who manages the IOCMS system next week, and they're going to see if it's something that we could maybe, instead of reinventing the wheel, if it's something that we could tap into their system. The way it works is at the DOC, they take each individual and they send that money to each county. So for example, he said that if I ask the controller's office, which I haven't yet, that they actually get a check from the PADOC saying this is for this person's Allegheny County restitution, Allegheny County fines and fees. So the way the man explained it to me was because we only have one county that we're really talking about here, it would be easy because there's no actual disbursement to other places. We could do most of those things in-house. I'm also planning to reach out to someone within the controller's office about, we need a classification of employee, because it's an incarcerated employee, an incarcerated individual, that would be its own classification. And then I also sent an email out to Nova Time, which is the terminals. My idea is that basically when they leave at 4 a.m. to go down to the kitchen on their way out of the pod, they'd swipe something or enter in their DOC number, and then when they come back to the pod at the end of the day, they'd swipe something or enter their DOC number. But actually, it looks like this could be implemented fairly simply. We just need to find out about tapping into the IOCMS system, because it would do everything for us. It's programmed to do the deductions, do the disbursements, and so I just need to get a few more answers. But the call I had with this man was great. I'm really excited about it, and it was the big hurdle that I needed to get over because I needed to know how does someone who already does this do it so that we can figure out how we can do it.
And Ms. Hallam, once you have the information, can we schedule another IIWF subcommittee meeting, and maybe we can go through everything and see everything that you have, and then maybe have a plan to go forward?
Yeah, I'm ready. Actually, like if we want to talk about it later, I'm ready now. I have the policies. I have the timesheet that he sent me, the timesheet that they use. I have information on the software. I have information on Novatime. So I'm ready, just so that you know whenever you want to schedule.
Okay, great.
Yeah, but I'm really excited. It's coming along. Yeah.
So update regarding Summit's dietitian attending the meeting. I forwarded a number of questions from Terry Klein to Summit, which they responded in writing. I provided those answers to the board. Also received a number of questions from our county controller, Corey O'Connor, which I believe they were yesterday, and I forwarded those questions to Summit, and they returned responses today. And again, I provided those answers to the board. Judge Lazare, alternative housing population statistics?
Well, this is the status of the jail population as of 4:30 p.m. on October 2nd. So I have to get them done in advance, so they're never going to be to the day of today. But I think October 2nd is not too bad. So as of 4:30 p.m. on October 2nd, there were 1,380 people in the Allegheny County Jail and 152 people in alternative housing. This excludes any people that are in the jail or alternative housing on federal government holds. 7%, that is 90 people in the jail itself, are serving a county sentence as a result of a new conviction. 22%, that is 307 people in the jail, had a hold from an external jurisdiction. So that would be other counties, so maybe Fayette County, Westmoreland County, wherever, or state holds. 41%, that is 563 people, I should have brought my glasses, 563 people in the jail were detained by Allegheny County Adult Probation. So they were detained for violating probations for matters on which they had been previously convicted. Of those 41%, or 563 people, 88%, that is 497 of them, were of moderate or high risk to reoffend based on probation risk proxy scores. The remainder were being held for a variety of reasons, including violent felonies, awaiting mental health commitments or service plans, and other reasons related to their own safety or the safety of the community. 20% of the people in the jail, that is 357 people, were being held pretrial only, meaning that they had no other reasons, such as external holds or detainers, keeping them in the jail. Of these people, less than 1% screened as low risk for reoffense based on the Allegheny County locally validated pretrial risk assessment. 6% of the jail population, that is 86 individuals, are currently being held in the Allegheny County Jail pretrial only on monetary bonds. And of these individuals, only 2 screened as low risk for new criminal activity, and both of these individuals were facing violent charges. By the way, all monetary bonds are reviewed for possible bail modification. Just so that you understand, at March 16th, 2020, when the world shut down, the inmate population of the jail was, oh my goodness, 2,075, including 1,859 in the jail and 216 in alternative housing. So as of October 2nd, that population again is 1,380. It's a 26% decrease in the jail and a 30% decrease in alternative housing. The detainer population in the jail as of March 16th, 2020, again when the world shut down, was 889 people, and as of a couple of days ago on October 2nd, it was 563, which is a 37% decrease. So those are the numbers. Yes, Ms. Hallam?
Yeah, one thing, do you have the percentage of people who have BC holds?
Behavioral clinic holds? I do not. I have basically what reasons the courts have for keeping people in. I don't have the number of people that are on, specifically that are on BC holds.
Who puts the BC holds on them? It's not the courts?
Well, that would probably be pretrial services. I could probably get that. I don't have that.
Okay,
I can ask for that for the next one.
I would appreciate that very much. And then the last thing is there any way you could like email this to us with the packets when we do it every month? I'm scribbling trying to like keep up with you, and it would be so much easier to just have these numbers in front of me, and so that you didn't have to like read them and.
Yeah, my problem is when I got it and printed it, it was lost in my email box for all the mental health court stuff that we get is a lot. So I printed it today, so I'll make sure that it's sent before. I'm sorry.
Thank you.
Because I'm trying to get it from from court administration a couple of days in advance, just so I can distribute it, and I apologize. That was my fault that I didn't
No, I know
send it.
you have a million things going on. I
No, I'll
appreciate this
send it.
very, very much. Thank you.
Thank you. Update regarding the Ncchc contract. Mr. Pilarski?
I do know that that contract has been finalized and signed, and upon it being final, they started doing a documentation review, and they're looking at coming in on site the very beginning of November. Sometime in early November they'll be in, but they have already begun a document review, and they'll be on site early November.
Yeah, Mr. Pilarski, what is the total cost of taxpayer dollars that we are paying the Ncchc?
I don't have that with me.
I do. It's $76,400 that we are paying an outside entity to do the job that this board is statutorily mandated to do. So I just wanted to make sure that that got in the record. And also, we skipped over the other Ncchc, the reinspection report. Thank you.
Any other questions for Mr. Pilarski? All right, Warden, if you could, out of order, if you could do the suicide prevention update.
Your Honor, we have not received the draft report yet. As soon as we receive it, we'll let the board know.
All right, thank you.
Can I ask a question, Judge Halsey? Did we move public comments for this meeting? Like, is it in a different space on the agenda? And if so, why did we do that?
We arranged the order because of Warden Harper's obligations this week. We rearranged the order.
But it's only for this week. We're going to go back to the old order.
I don't know about that, but this is the order for this week. So with that being said, review of the minutes.
Dude.
So moved.
Does anyone want to make a motion?
I'll make a motion.
So moved that we, I'm sorry, did somebody else do that?
Joe Moss make a motion.
You can do it. It's okay. I move that we accept the minutes
I'll second it.
All right,
of the last meeting.
motion properly made and seconded. All in favor?
Aye.
Any opposed? Motion carries. We'll now have our public comments. And I will just remind you, we limit public comments to a total of 3 minutes. At 3 minutes, I will inform you that your time is up. We have approximately 21 people that have indicated they'd like to give a public comment. So we like for everyone to have an opportunity to speak. Please be respectful. We don't do questions. We don't do questions. So please be respectful of each other, their time, and no disrespectful comments to be made. With that being said, first on our list would be Nicole Rimmer. And I want to apologize in advance if I mispronounce anyone's name. Some of the writing is not great, so I apologize in advance. Ms. Rimmer.
Judge Halsey, can I just ask that we have people state their name and spell it for the record so that we can make sure that our minutes will accurately reflect people's names? I mean, we do that in a courtroom, and there's no reason.
You're right.
You know, that way we can have the actual name and the spelling and the correct pronunciation so we don't butcher it the next time.
Great
Okay.
idea. Thank you.
Thank you, Judge Halsey. My name is Nicole Remmert. It's Nicholeremmert. Do you need my address as well? Okay.
I don't think you want to put that on the record.
Well, it's on that sheet, so. I am here to talk about the books, but Councilwoman Hallam and Controller O'Connor have begun to address some of my concerns. I was actually the person who alerted Councilwoman Hallam to the fact that the list of books denied or admitted, any books submitted for review to the State Department of Corrections are easily available. A simple Google search using the terms Pennsylvania prison banned books, brought that page up really quickly. On that list that they publish and keep regularly updated are the names of the books, whether it was denied or permitted, the type of publication, the publication date, volume and issue, and specifically the pages with the objectionable content. I think that would all be really helpful. This issue was brought to my attention by Andrew Iden, who is Congressman Lewis's co-author of the March books and the Run books. Those books were written on my patio several years ago. So it was extremely disheartening to learn that those books were being rejected, and Andrew was very upset about it and prepared to get his publisher involved, and he is still prepared to do that. I was pleased to hear from the warden that perhaps it wasn't a content issue, but that it was some sort of administrative issue that was preventing those books to come in. However, it does not address the content issues that both Councilwoman Hallam and Controller O'Connor brought up, and I'm glad to hear that those will be addressed. What I also saw on the State Department of Corrections website is that they have an incoming publications review committee, and the review process is detailed, including the responsibilities of those folks immediately following whether there is a review. So I think that these are things that are already happening in our state that should be easily replicated here at the county level, that would really help to, in a small way, increase some transparency, perhaps build some trust if that's of interest for the folks at the jail. So I'm very pleased to be able to go back to Andrew and also to Nate Powell, who was the illustrator of those books, and let them know that, in fact, it's not a content issue, at least as far as was reported today. I know that Andrew's going to be keeping an eye on this, and I will also be doing that. So I just do want to state my appreciation for Controller O'Connor and Councilwoman Hallam, though, for being on top of this today. Thank you.
We will now hear from, forgive me for the last name, it looks like Kevin Cordsey. Was there a Kevin Cordsey, perhaps? Looks like K-O-R-D-Z-I. Oh, I didn't know. Thank you. All right, fair enough. We'll now hear from Reverend Richard Freeman.
Good evening. I'm Reverend Richard Freeman.
State your name, spell your last name, please, if you don't.
I will. R-I-C-H-A-R-D, last name F-R-E-E-M-A-N.
Thank you.
17 people, 17 human beings have died. Let that hang in the air just a moment. I want to say to this board, I am appreciative that you've responded to some of the demands that I, as a president of the Pennsylvania Interfaith Impact Network, have presented to you. Thank you. But I also want to say that I am a businessman, is also a pastor, and I know what CYA looks like when I hear it. The report that I heard from our warden, I read in the paper in advance. It did nothing to say anything about the report that came from Pitt. It was a regurgitation of policy. It won't do a thing to stop men from dying in our county jail. When I was a young puppy, I read a book by Alexander Solzhenitsyn called Gulag Archipelago. And I was disgusted when I read it. I'm now an old dog. And as an old dog, I'm beginning to see that we have some of the same problems right here at our county jail. I won't stop until we do something about it. You know why? I've had a loved one in that county jail. I've had people who I pastor in that county jail. And it's only by God's grace they didn't die. I will work as long as I can and as hard as I can to hold all of us to account. I hope you heard that word, not y'all, all of us, to account, to make damn sure that we keep another person from dying in the county jail. I also hope, and I will commit myself, I can't commit our organization yet because I answer to a board, but we're going to make sure this doesn't happen anywhere in the Commonwealth of Pennsylvania. Nobody needs to die in our jail, period. Last thing I will say, if this were a dog, everybody would be outraged. These are human beings. I wish we were more outraged. Thank you.
We'll now have comments from Sister Barbara Finch.
Sister Barbara, B-A-R-B-A-R-A, not like Barbara Streisand, and Finch, F-I-N-C-H. Thank you very much for hearing me. I am part of many social justice organizations and faith communities here in the area, but more importantly, I'm a former employee. I was employed as a medical nurse at the Allegheny County Jail. I served for 10 years. I served under the Health Department, Horizon, and the prison system. The first warden that I worked, and it was 5 wardens in the 10 years that I worked under. The first warden, Warden Rustin, said to us, and I was on one of his committees, and we worked with the broader community, saying that 3/4 of the people in my jail does not belong here. This shouldn't be a place for the mentally ill. It should not be a place for the addicted. It should not be a place for the prostitutes. And it should not be a place where people are kept for months and months on detainers. And we work to try to find alternative programs for people, which hasn't happened in all these years. When we ask for additional staff or additional needs, we were always told it's not in the budget. We can't afford it. Well, I'm here to tell you that I worked under a broken management my last tenure at the jail. There was a continuous change of director of nursing. The upper management of the medical department was not medical at all. It makes no sense. There was an effort that we would have the Allegheny Health Network that was thought to be an improvement. However, only the physicians and the physicians' assistants were under Allegheny Health Network. I was hired by the county, and my boss was Warden Harper, Rich Fitzgerald, and Rich Fitzgerald's county manager. And I'm sorry, with all due respect, Warden Harper, you ordered me how to deliver my nursing care. And to my knowledge, you have CPR knowledge, but you do not have medical knowledge. I was a sick call nurse. And you removed our sick call rooms so there was no longer privacy. You said we would be disciplined if we violated HIPAA, and here I had to do my sick call in the middle of a pod. That it was a violation of HIPAA. We were able to do so many more services with the sick call room. I actually assisted in working with the females in gynae exams so that they didn't have to go up to the clinic. That was all eliminated from that. Sometimes I was assigned to be the diabetic nurse, the only diabetic nurse in the whole facility. So when you're talking about time of delivery, one person can't get around to everybody in a timely way. Same way with all the other medications. One nurse, and I've had to do that as well, will have 2 to 3 pods themselves with 90 to 100 inmates, and almost everyone is on medications.
Sister Finch, I apologize for interrupting, but you greatly exceeded your time.
Thank you. You're welcome.
We'll now hear from, and I know I'm going to mispronounce the last name, Sharon Bonavoglia? Not bad. Not bad?
I'll be here monthly, so you're going to have another try. My name is Sharon Bonavolia. It is Sharon, S-H-A-R-O-N, Bonavolia, B-O-N-A-V-O-G-L-I-A, and that doggone G is silent. It'll get you every time. My tears are meaningless, and I don't want them to interfere, so I'll just take a breath. Reverend Freeman asked us to consider the deaths of 17 people, and I believe it is extraordinarily important that we do that at every one of these meetings. So I will read their names, and I will ask all of us here to consider their families and their friends, the people they worked with and worked for, the people who no longer have them and never will in this life. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, and shamefully, one last name from last month's, Anthony Talota. I would also suggest that it is disingenuous at best and potentially against federal and state regulations to disregard the deaths of people who died in the hospital after they were released. That release does not release the Allegheny County Jail from responsibility for their care or lack thereof that potentially led to their deaths. If I mispronounced any of the names and anybody here knows that I did that, I would greatly appreciate it if you could see me at some point after the meeting or contact me some way so that I could be ensured that I am stating their names correctly in the months to come.
Thank you for your comments. I believe this is Janelle Tipton. I can't tell if that's an N or an M. Janelle Tipton, thank you.
Good evening. Janelle Tipton, Janelle-Tipton. I am a mother. Good. My son is incarcerated. He is 30 years old. On September 16th, he was strip searched. He was handcuffed first. He was tased over 5 times to find nothing in his cell and to also find nothing in his body. My son's humerus, his right humerus, was broken in half by C.O. D'Angelo. And C.O. Turner also punched and kicked him along with C.O. D'Angelo while, let me get these names right, Sergeant Barker and Captain Dean Bosey stood by and watched. And also, Sergeant Barker put in a little kicks and punches too. This is all in his cell. I was not notified that my son was even in the hospital until 3 days later because I called the warden's office and his assistant said that's their policy. If it's not life or death, they won't call the family. So 3 days later, I had to find out that my son was in a hospital by another inmate. Now you tell me, these COs, are they respectful? Absolutely not. So Warden Harper, you need to get fired. And also everyone under your watch needs to get fired as well. And I hold every last one of you guys accountable. So do your jobs and get this situation in this jail correct. And if anything happens to my son after this, you damn well believe that I will hunt all of you down to make sure that you will be accountable for it.
Janelle Tipton. Yes. It's been brought to my attention that a number of board members have other obligations, so we're going to take a vote regarding your last two motions, Ms. Hallam.
And will we resume public comments after we vote?
Of course, Ms. Hallam.
Just wanted to make sure. You never know these days. Okay, so the first one, I'll wait till after public comment to do my report about my visit, but this motion directly ties in to, on my most recent visit to the Allegheny County Jail, it was, I think, 2 days after Mr. Talata died in the jail. On the pod where the kids are held, yes, there are children in the Allegheny County Jail. Their basketball hoop has been broken for quite some time now, and a whole group of them said to me, you know, we're the only kids in here. Why are we the only ones who don't have a basketball hoop in our gym? So their requests were that they either move the kids to a different pod. I mean, personally, I think they should just all be out of the jail, but either move the kids to a different pod or fix the basketball hoop. So my motion is a motion to request money from the Incarcerated Individual Welfare Fund to be spent to purchase and install a replacement basketball hoop for the gym on the juvenile housing pod. So I would like to make a motion to approve and ask for a second.
Second discussion.
Yeah. I would love to discuss this, Controller O'Connor, because I know what you want to say about it.
I can.
Deputy Beeson.
Deputy Beeson, I believe there's a facility issue there.
Pod 5MC does not have a basketball hoop because of the physical plant. So when you were on there, you noticed that it's a single-tier housing unit. The gym ceiling is the same height as inside the pod, meaning it's maybe 10 feet tall. On the ceiling are pipes for the sprinkler system. On the walls are conduit for, for electrical power. So there's nowhere to put a basketball hoop in that area.
There's a board there on the wall.
Okay.
Just no hoop or basketballs. So again, the only kids in the whole jail are the only ones without a basketball hoop. There's not a single other pod that I've seen that they don't have a basketball hoop. And so I'd like to motion. I got a second, and there's discussion.
I think you missed. I think you might have missed the point. The point is a basketball hoop is typically at 10 feet. There's no place to put a hoop in a room that has a 10-foot ceiling. So maybe it might make sense to move the juveniles to another pod. I don't know. I can't answer that.
Can we put,
But
according to the motion, a basketball hoop in the interim?
I wasn't finished. So understand that there's no way to physically put a basketball hoop in a room that has a ceiling that's lower than 10 feet.
There's a backboard, Your Honor.
Well, I've never played basketball, so I wouldn't know.
Okay, well, there's a motion and a second, and again, that they are not asking us to let them out of jail. They just want recreation. They are the only pod that does not have a basketball hoop, and all they are asking for is to be able to play basketball in their gym.
Right.
Yeah, Debbie, are there security concerns if the basketball hoop is not at 10 feet, which would be a normal basketball hoop?
If there's anything that can be tied off on, it can be considered a ligature point. So
Oh my God.
So I have a question, not about the height and basketball, and everybody knows my height, so I clearly didn't play basketball. But I have a question about the fund that we're using, and I agree, I'll vote for it, I have no issues with that. What I guess I'm getting at, my question would be around capital funds and capital procedures. So, we usually put out like a yearly capital expenditure. And I know things can happen, a pipe can break, a floor, there's an issue, whatever. Do you guys put out like a yearly budget for capital? Is that something that you have? Is there, a year-end report? Like right now, we're coming to county budget season where we're going to present capital budgets. But do you guys do that at beginning of the year, fiscal year? Is there a capital budget that has $100,000 in it that you sort of look towards redoing something in the jail each year? Is there, I know there's always like a rainy day fund in case something breaks, I get that. But is there a capital fund that instead of using the inmates fund, could we use something else?
So we do put together capital planning, and
Okay.
we are afforded as part of the county budget. County council approves, we get a amount that is our capital fund. We do have funding that we use for repair, but as Chief Beeson stated, due to the logistical issues there, that it's not.
I'm not asking about that.
Yeah,
It's a
but
general,
we do have.
So you do have a fund, and then do you have a line item, sort of, I have these 5 priorities this year. Is it line item when you get that sum of money, or is it just the county council votes on the budget and there's $200,000? I'm just using numbers. I'm just asking general numbers. So from that number, is it line item what you're going to be doing that year?
So we evaluate, and we're constantly reevaluating quarterly, because based on needs or, like you said, new events, our capital priority may change.
So basically, you don't actually have an overall capital. You have a capital that would allow you to fix issues as you go along, but it's not a capital that is, we're going to put in, and I'm just using this, 3 basketball hoops this year that cost $20,000. So you actually don't have the long-term capital. And this is just, I just want to learn, because this is only the 3rd meeting, but you actually don't have a long-term capital plan, but you have money that could fix issues. So if there is a problem that comes up and you want 3 things, you would probably have to go back to county council to request that in a capital budget plan. Is that what I'm hearing? Like if you exceed that number, because it's there to, and Steve, if you can jump in, yeah.
There are specific capital requests that they put in for would be approved as part of the overall budget. Then there's also,
the rainy day fund, whatever happens.
I might say, like to your point, I might say, hey, look, we're going to install 3 basketball hoops, or we're going to do this. But then something else happens, and I have to use that money to fix a more immediate or emergent issue. So there is a capital budget for specific items, and then, there's always overages and stuff like that. But so, and again, if they would need more, they would have to go back and ask for more, or something like that.
Right. That's more or less the process of it is, I am allotted this money at the beginning. We have budgeted for that for the year. But if something else breaks or I need additional funds, I come back through that process.
Yeah, you had specifically for this, and then you find out the roof's leaking.
Right. Yeah. I just want to know that there's a yearly capital plan that you present to county council. That's what I'm trying to kind of figure out. Okay. Thank you.
Can I offer a friendly amendment?
If it's actually friendly.
No, it is friendly.
Yeah.
I mean, there may be security or health concerns with putting a 10-foot hoop up in a ceiling or whatever. So if that cannot be done, can we ensure that the juveniles have access to a recreation space that has a basketball hoop every day? So either they get transported to do that recreation, or they get moved entirely to a space that has an ability to have a basketball hoop.
I would accept that friendly amendment as long as it's at the same rate that they would have access to it on their pod.
Yeah, well, that would be the idea.
Okay, so I don't want it to be a once a week they go to the gym.
Maybe there's an issue with a 10-foot ceiling and pipes and stuff, and you hit the basketball. I'm short. 10 feet for me is forever, but if there is that issue, then I think if we can make other arrangements to make sure that the juveniles have access, because we're doing these interest of justice hearings, and we are hearing about, what their conditions are in the jail on a monthly basis, and it would be nice to make sure that they are having recreation that makes them, feel as better as they can in that incarcerated setting. So that would be my friendly amendment.
If I can just,
I accept.
The warden or Deputy Beeson, are there any, I believe the juvenile should exercise the whole bit over the beat. Are there any operational issues that we would need to think about or make sure we address?
There's logistical concerns. I mean, who's going to be moving them to that space? Who's going to stay with them while they're in that space? Who's going to bring them back? We had recreation going on pre-pandemic where we used the big gyms that are on all the general population levels. Since we stopped moving folks to a limited movement within the facility because of COVID mitigation efforts, that has stopped. If and when we can go back to full recreation, we're going to consider resuming using those large indoor rec spaces. At that point, then we could move the juveniles to use those spaces also. So we have officers that have bids to be in those areas of the facility.
So what I'm hearing is if we were at full recreation, then the juveniles would be recreating more regularly.
Correct.
And because of the COVID mitigation, all adults and juveniles, all the exercise is on the pod right now.
Correct.
Sorry.
I was going to say, I mean, I don't know other options. I mean, is there other options?
That's the question. There has to be another option.
Could we move them? Is that logistically more feasible? Move them to a pod that is, because I know we have empty pods. Could we move the juveniles to a new pod? That was their actual request. I just thought this would be an easier lift, but I am open to that.
Is there, again, I don't want to necessarily delay this. I do agree with exercise or whatever, but can you come back to the next meeting with potential options that we can consider so that, it's just, again, I'm not looking to delay it, but I don't want us vote on something that can't happen either. Because we don't have all the answers right now. That's all I'm asking.
Is the claim here, I'm sorry, maybe I misunderstood, that the pipes could be used as ligatures? Is that what the claim was? I'm very confused by that.
Because the ceiling is so low, if you add a rim, you can have access to it.
What, you're saying they would like hop up on the rim and then hop up to the pipes? I don't understand what you're saying.
Tie off to the rim or tie off to the pipes?
On the pipes?
On the rim.
So you're saying you're not going to allow them to have basketball no matter where they are?
It's just because of the ceiling height in that housing unit. It's so low to the ground.
Yeah, but you can reach the rims in the other pods, in their gyms. You can reach the rims there.
By jumping, you can reach them.
Right.
In the general.
Everyone can't reach her.
I don't know if we can come up with a solution right now. I mean, if the board would allow us to come up with a solution to the board by the next month, we can do that. But right now, I know we can't come up with a solution.
With the understanding that there will be no delay, that next month there will be presented to us a real solution to make sure that the kids can have exercise, basketball on their living center.
Yes, ma'am.
Sorry. I don't know how order works here.
There's been no order.
Motion?
No, I'm not tabling that motion. We have a motion in a second.
Wait, I just on that. So based on my original question on the fund then, I think this would be the amendment to the motion would be, can you pay for that or does it have to come out? I don't know what your expenses are.
The money isn't the issue.
Left. Huh?
The money isn't the issue.
Well, no, I'm thinking the money, it shouldn't come out of this fund because this is a capital expense at the jail. I'm making the argument that do they have the money left in budget to do this so it doesn't have to come out of the welfare fund?
That fund makes so much money from profits off commissary.
I know, that's why I'm looking at it as just the technical, do they have the funding to do that without having it to come out of that fund?
So, Mr. O'Connor, we do have the money, and we have hoops already at the jail now.
I understand that, but the additional of this, do you have money to install if we didn't have to use this fund to do it? Yeah. And this fund could go to other things, and so it's a yes.
Yeah. We have,
right.
Yes.
Okay.
Yes.
That was my question.
But not on the current juvenile pod.
I know what you're saying. I get it.
Yeah, because of the facility issues.
What? Listen, I get told every month something's going to happen next month. I am like,
I don't know whether you accepted my friendly amendment.
I accepted your friendly amendment for now, yes.
But it would be that there must be a solution for next month, not another runaround.
No, I don't want that one.
It'll be absolutely determined where they will go to make sure that they can play basketball.
No, I thought the friendly amendment was until they figure out a permanent solution at next month. The friendly amendment was you would either put a basketball hoop on their pod or take them to a basketball hoop every day. That's what your friendly amendment was. I will accept that and second that and vote on that. And then by next meeting, they can propose either a new pod. We have lots of open pods for them to move to. that have basketball hoops already, and we could save all that money.
All right, I really have to go.
I know you do, so let's vote. We have a motion and a second.
I have like a kid sitting somewhere who's like, it's not a good thing.
Can we take a roll call on the friendly amended motion?
All in favor?
Aye.
Any opposed?
Terry, you were an aye?
That was an aye.
Ayes all around. Thank you. Okay, the next motion is.
Wait. You know I have a yes. You have a yes.
I know you do on this one. Thank you so much, Judge. Okay, second motion, and again, Ms. Klein referenced it earlier. We usually do a $100 a month motion onto the books of every single person in the jail, but because Summit has been consistently overcharging for commissary, and we cannot apparently get out of that contract until the end of the year, every month until the end of the year, we are going to give them $125 instead of $100, just to kind of say our bad. So I'd like to make a motion to request money from the Incarcerated Individual Welfare Fund to be put on the joint tablet commissary accounts of each person. At the time of my drafting of this motion, there were 1,450 folks incarcerated in the jail, $125 for each person for a total cost of $181,250. I would like to make a motion to approve and ask for a second.
I second.
Any, motion was probably made and seconded. Are there any in favor? Aye. Any opposed? Motion carries. We could have Dave Swanson. It's your opportunity to speak. Sir Dave Swanson. Okay. How about Elizabeth Shangar? Shangar, my apologies.
Hello, I'm Elizabeth Schonger, Elizabeth. Schonger is Schongar. I was very concerned to learn from Casa San Jose that people who do not speak English at the jail are not provided interpreters. I was asked then if I could read a statement that they were not able to read here, and I revised it a little bit to reflect my own concerns, but this is basically what I got from them. Casa San Jose is tired of asking for interpretation in life and death situations. Given the intake at Allegheny County Jail includes questions about detainees' medical situations, denying them interpretation in their native language could cause death. Casa San Jose calls on Warden Harper to stop putting our immigrants' lives at risk. Do your basic job. Provide interpretation in your intake, in the jail, and at discharge, and hold your employees accountable. Casa San Jose also says that they find issue with the way that these board meetings are run, and I agree. We, the people with family members in jail and those that care about human rights violation in the jail, do not feel like our voices are heard in the way public comments are actually being made. Public comments submitted online are not adequately read. They're either summarized or omitted entirely from the board meeting. Including them in the board minutes is not enough. Additionally, when a report is made by jail employees or contractors after public comment, we do not get a chance to address that in our comments. When we are not given that chance, we have to wait a month to address the issues. And finally, it's not fair that the warden, who's not legally on the Jail Oversight Board, takes so much time away from the public who is seeking justice.
We'll now hear from Tom Hoffman. Sir Tom Hoffman here. All right. Brandy Fisher, you're up.
Good evening. I kind of lost what I was going to say between babysitting and the length of
I
time.
apologize for interrupting. Could you please state your name and spell your name for the record?
Oh, sure. Spell my first and last name.
Please, if you don't mind.
Brandy, Brandi, Fisher, F as in Frank, I, S as in Sam, Her. All right. So we've been here and we've been coming here and you've seen press conferences, so you know the demands that we've made. I do want to just acknowledge that 4 of the things that we were asking for that were mentioned today, I want to highlight that around the medical demands and the emergency, the immediate medical attention at people who are incarcerated request, and that the determination that their determination to provide care not be left to correctional staff being effective immediately. I did want to highlight that that it said that there was still an 8-day wait period, and how I still believe that that was a long time for someone to wait for medical care. And then on the other, with the demand for incarcerated individuals be given the ability to add, delete, or modify their emergency contact information. I was just wanted to note that everyone doesn't have a tablet, and I know that that was talked about, but there wasn't a definitive response or answer to what would happen for people who didn't have a tablet. As far as the wait time, I mean, if you have to write and send and there's already a long period. So I wanted to just highlight that as a gap of concern still for people who do not have access to tablets when they're in need of medical care, or to change their emergency contact information rather. And then the other one, where there was a time frame stated in this one demand/ask about the I'm sorry, and I know my time is ticking, I'm gonna catch up. Oh, about the 2 hours. The jail, that the county jail notified the emergency contact and the jail oversight board in the event of an incarcerated individual's medical emergency, hospitalization, or death within 2 hours of the event. I did hear it being spoken to, but there was no time frame stated. We directly asked for that to be done within 2 hours, and I'm still concerned that that is not what's going to happen, because it wasn't stated that that time frame would happen. It was just that they would be notified. And one of the issues is that they're not notified in a timely manner, that they don't know what's happening, immediately. And so I just wanted to note that and to see if that could be addressed at the next meeting from the warden and his people. To make sure that that time frame is stated. And then I just wanted to add on that, this mask mandate being lifted is giving me the impression that the jail doesn't think that COVID is still a serious issue, but it is also being used to still keep people locked up. So I'm confused as to where the jail's position is on COVID and the COVID cases. So in one instance, I'm hearing that, we're going to lift this mask mandate, but then we're saying people can't have rec time because of COVID. So I would just wanted to note that that doesn't make sense. It kind of sounds, oxymoronish to see what is the real reason that we're not allowing people to have rec time, or we're not allowing people to be out of their cells, because it can't be COVID if we're lifting mask mandates. And then lastly, around the youth who, am I over time? Oh, I'm sorry. I do just want to know this, and I'm going to go. Around the youth and the rec time, I think the youth should be a priority because they shouldn't even be in that jail. And I just heard a lot of excuses being given to the jail from the board, particularly you, I don't know your name, I'm sorry, for them not to be able to do that. And I would just really hope that we are looking more for solutions, especially when we're talking about young people instead of barriers. Thank you.
Marion Damsick? Damick. Marion Damick. I'm sorry. So do you?
Get her purse so she doesn't please herself.
I'm going to fall at my own purse. Okay, here I am.
Right, sorry.
Before you start, ma'am, if you could just state your...
D-A-M-I-C-K, like, damn it.
Thank you very much.
Okay. I was going to talk about something really frivolous about with these reports, which don't make sense if you look at them. But other things have come to hand, which I know about because for so many years, Sister Barbara was the person, the nurse to call when ICLU, Orange Prison Society. I knew to call Sister Barbara to find out what was going on. Cough, cough. However, if you're talking about playing basketball, you've got a gym, you've got the basket, you've got the ball. You have 15 guys, juveniles, here who could play basketball. Are you talking about it costing $150 a month? I would donate $150 a month easily. For God's sakes, have them do it. It's ridiculous. It's also ridiculous, unfortunately, the location of the jail. They really ought to, sort of put it somewhere else. Because legally you have to be able to come out, get out. And what you have is an open side, two sides of a room where they go and breathe the beautiful air that's around the driveway. I'm terribly sorry. If you're going to go, what kind of you? We have very kind police. But I can't.
I'll hold it for you. When you're ready for it, I'll give it to you.
It's spilling over. Thank you. Whoops. Okay.
You ready for it?
Thank you.
Mm-hmm.
I'm used to wine, but that'll do. I was going to talk, maybe I'm talking about my favorite animal around here, the rat. Maybe we're talking about rats, but I don't hear much about what's going on with getting rid of the rats. Have you gotten rid of the rats? Has the country, their accounting, have you had somebody go down and get rid of them so you don't have, I will use the word shit, of the rats in the meals? That's what it's been, and that's what it's got to stop. I mean, it's, nobody can eat that, and they don't. And that's it's all our fault if we let that go on. We shouldn't. But take me up. If you want, if it's $150, I'll pay $160. A month, I'll give it to you. And I can take it off, as a donation to the county. So there. Goodness sakes. Get the kids to have something outside and breathe air. In fact, in playing basketball, it's inside. Whatever. Okay? Bye-bye.
We'll now hear from Tim Stevens.
We all should be that strong at that age. Long time.
Tim Stevens, STEVENS, Chairman of BPEP, the Black Political Empowerment Project. STEVENS. First of all, Judge, we should not do this to the public ever again. That young lady with that beautiful boat has been here since 4 o'clock. There are people who come to speak to you who may not have 3 hours and 15 minutes because of family responsibilities. Please don't do this again. Don't do it again. A couple things I want to highlight from our press conference from Monday. The July 31st Pittsburgh Institute for Nonprofit Journalism report showed, you all have this, I just want to make sure it's in the record. It's been cited for violations 162 times by the Allegheny County Health Department since 2014. That PINJ report said mice were eating into the bags of food in the kitchen. The discontaminated food was routinely served to prisoners. Roaches had been crawling on the kitchen walls. The PINJ said the report also stated that black slime bubbled up from a kitchen drain where food was being prepared. The University of Pittsburgh study gave voice to the people being held in jail. The year-long Pitt survey said people in jail reported that they were served meals crawling with roaches. There were bugs and mildew in the shower. Necessary medications to stabilize diabetes and to maintain mental health were withheld for days. Only 25% of the prisoners said they were sufficiently warm at night. These conditions, as we've heard over time and time again, have gone on far too long. The people in this study and the people in your custody deserve to eat healthy food, roach-free food, to shower in facilities free from bugs and mildew, and to have their medications delivered on time. I was told on a bus ride yesterday, someone lost their leg in this prison. Someone on the bus knew someone who lost their leg in the prison because they did not get medications in time. Please do what must be done to show your firm commitment to the numerous important changes that have been outlined by all the people, the letters that you've gotten. In our press conference on Monday, Kim Williams from APA said something that horrified me. She said there was a woman that she knew in the prison that took a sock and made it a feminine napkin. I have too much respect for women to ever hear that again. Please take these, give them to the women, go buy some more. This should never happen in this county. I'm done. Mr. Warden. Please don't let that happen.
We'll now hear from Eric Miskovich. Is there an Eric Miskovich?
Hi, my name's Eric Miskovich. ERIC, M as in Michael, ISKO, V as in Victor, ITCH. I was going to ask you, Judge, if it's possible if we could have an exception to the rule here today and allow me to just speak for a half hour, if I do good, or something like that. Okay, well, there's, all right. In any event, I came for the shit show. That's why I came here today. Actually, I didn't. I swore, and I just wanted to see if you were going to check me on that or not. See, because there needs to be an application of rules that are applicable to everybody all of the time, not some of the time or whatever. But like, I objected at the beginning of this meeting, and I almost got tased by him when Rich Fitzgerald didn't show up. I'm here to see the wizard. Where is the wizard? And Warden Harper, you owe me responses to grievances I filed years ago, dude. Where's my responses? Seriously. I got problems in life, right? And I wonder, why do I have these problems? Warden Harper, I'm going to have the Attorney General investigate you, not civilly, criminally, my man. And you, Mr. Elliott, I would like to have a job like you got. Why don't I have a good job like that? Who do you know? See, that's not how the system's supposed to work. This isn't about white or black, by the way. This is about right and wrong, right? And we all know the difference between right and wrong, right? I do. And yeah, I came down here and I drove without a license to get here today. But this was important to me, and that's wrong, and I shouldn't do that. But sometimes you gotta take the risk. No risk, no reward, right? And I hope I don't get murdered for driving without a license today. But, you know, like, this man here, he has a strict application of rules, and you got a good sergeant like this dude over here, he can't do his job. He got his hands tied. Rules aren't meant to be inflexible, but they do need to be there, and they need to be consistent and enforced regularly. You know, in a perfect world, we're all supposed to love one another, actually. You know, so I feel, young lady, you have hate built up. I do too. That's our egos speaking. You got to get rid of that stuff. It's useless. You know, you, sir, I don't know your name. I don't even care what your name is, but you're sitting here like you're Mr. Fitzgerald. Now, you can't feel, or Mr. Fitzgerald can't feel these folks' pain. Can you relay that to him? You're going to relay that to him? Where's Fitzgerald? Now look, if I got fines and court costs due, you will put a warrant out for my arrest. And that man will come and get me. So I'm ordering you, because you work for me, pussy. You hear me? You work for me. I'm ordering you to order him to go get Fitzgerald, sir. Yes, sir. Yes, sir, I get it. I get it. You're here to keep the peace. You know what your job is, and you got a tough job to do. Now, how are you going to do it with your hands tied? You can't do it. You can't do it. Now, I got a job to do, too. I'm a good human being, and I'm a decent citizen, and I'm fucked up. I can't do my job. Okay, I don't get the extra time? Oh, yes, sir.
We got other people like you.
Okay, my bad. I apologize, y'all, and I apologize for swearing, because that ain't me. That ain't me. But, yeah, you don't need that spot. Oh, I don't need that. I would like you to get that, because I got your swearing. And I'm passionate.
We'll now hear from Alan Gunther, perhaps. Forgive me if that's a mispronunciation.
Hi, I'm Alan Gunther, and that's ALANGUENTHER. Okay. Gunther. That's fine. It's been a long night. What I wanted to say was, when the Pitt report came out on September 1st, a lot of us were just stunned, and we had some church groups that don't normally come to these meetings, and they all came earlier tonight. So we had the Quakers and the First United Methodist Church and the United Methodist Church of Pittsburgh, and we have the Christian Associates of Southwest Pennsylvania. And I think of all the results in the Pitt survey, the 88% of the people who went to bed hungry at night, the 6% of the people who said they slept well, and the 25% who said they had adequate blankets. I think that's what really got a lot of our group members upset. And now, for those of you who are here, if you brought a blanket, if you have a blanket next to you, would you please stand? Would you please stand? And just show what people brought tonight, because they were so moved and so upset about what's been happening in the jail, and that the prisoners don't have the blankets to have a decent night's sleep. And what I'm asking is if you would take these blankets so that if the chaplain can help people, if the Tuesday program can help people as they leave the jail, would you accept these blankets that we've brought here to help prisoners? Can we leave them at the front of the, would that be okay with you?
It's fine with me, but I work at the jail, but that's fine with me.
If I leave them here in front of you, can Warden Harper, if it's okay with the head, here, if it's okay with the head of the Joint Oversight Board, he says it's fine. So can we give these blankets, come here, can we give these blankets to you? And would you please see and see that something is good with these? The well this is going to be, this would be the Tuesday.
Sure. Whoever. Okay, you're telling me about that. So if you want to leave the blankets, you can leave them. He'll do whatever he needs to do or not. That's completely up to you.
We want to make sure that these blankets are.
You have to understand, there may be a security risk associated with taking these blankets to the jail. So I can't guarantee those blankets are going to end up in the jail. I understand your point. I understand your concern.
Are there any other blankets that are here? Can we please bring those up?
Thank you, Mr. Goldberg.
And please, if you're not going to see that they were used by our Tuesday group, we just want to make sure that that they're used for good purposes. Because there were good people that brought these here, and we just don't want to see these wasted. We'll take them with us if you're not going to use them. But just like the other products which were said, we'd like to see these used.
Okay, thank you, Mr. Goldberg. Thank you. All right. We'll now hear from Tanisha. Sorry. We'll now hear from Tanisha Long.
Thanks. Okay, so I would love to be here talking about Tanisha. Tanisha Long, Long. I would love to be here talking about Mr. Talata's death if I had the strength to do so. But after a while, that stuff wears on you. So I'm going to talk about books instead. And I'm going to talk about the way that Warden Harper tries to circumnavigate and tries to get around the things that the board and the public have asked of him. I have a few things. I have the ACLU Abolitionist Law Center and Pennsylvania Institutional Law Project letter that was sent to the Jail Oversight Board and Warden Harper in 2020 telling him that his book ban was unconstitutional and cruel. This didn't matter, though. He rescinded that book ban and then made a new one. When he says he wants to investigate why his website and his policy don't match, he doesn't need to. I can tell you exactly when he changed it. On May 5th, Nadia stood up here and asked very specifically why the John Lewis book, Run and March, were not allowed in the jail. Warden Harper gave us a list of books that are banned for content and promised us that he would update the website, letting us know which books were banned for content. That is not what he did. On March 30th, and I can give you this screenshot, the jail website made no mention of a need for receipts. Warden Harper went in and added that to the jail website on June 15th. If you look at it now, today, what's on the website does not reflect the actual policy, which I've printed out for you as well. Stated in the policy, there's no mention of receipts. It also says that USPS, UPS, and FedEx can be used to ship books. Warden Harper made that policy up himself. It's not a policy, it's a practice. And honestly, I'm not going to argue about whether or not the policy is being followed because the policy is inherently bad. He is doing things to make sure that people who are incarcerated do not have access to reading materials, and it is cruel. In a place where people are dying, in a place where mental health issues run rampant, in a place where there is no relief, he wants to ban books. And for him, and for the ACJ Comms account, because I'm the one who tweeted author Andrew Aiden, and I'm the one who let him know that his book was not allowed in this jail, and he directly tweeted me back. The ACJ Comms account emailed author Andrew Aiden to let them know that I was lying and that this was a policy of theirs. It's a policy he made up. It's a practice he made up. So in a place where you don't have access to books, in a place where the warden makes his own rules, we've seen it with the solidarity confinement referendum, we've seen it with the don't bring lethal weapons into the jail, we already have them here. We've seen him do this. How long are you going to let this man make a fool out of you? Because he does what he wants. To be quite clear, he does what he wants. The cruelty is the reason. He doesn't have any other reason. And if we have to bring pads and blankets and books and everything just to make a point, there's no task force that needs to be formed. There's no committee that needs to be formed. You are the committee. This is your job. So if you want proof that this man made this policy up after being called out on the fact that he was banning a John Lewis book, the Constitution couldn't get in, Mouse couldn't get in. I have receipts, and he can say that he doesn't know where it's coming from. We've had lawyers identify on the gift receipts exactly who is sending it, who is the intended recipient, and he still sent them back. He's not even opening these boxes. Thank you. And if you want any of the proof, I can give it to you. Thank you.
All right, there's no last name. The first name is Kimberly. Now hear from Kimberly. Well, it's crossed out, Miss Kimberly.
Kimberly, Andrews. So what is this, like, I want answers. Like, I'm not here to comment, I'm here to question. So, and honestly, I'm not even questioning you guys. I'm gonna question who I know I'm gonna get real honest answers from. Bethany, so on this board, what's supposed to happen? What is this board for?
We are statutorily mandated to provide for the health and well-being of the people in the jail.
Okay.
All policies, investigations, all of that. We have a statutory obligation.
Okay, so during these comments and concerns and questions, excuse me, you're running my time. Comments, concern, and questions. During this time, if someone has a comment and concern and question, is it supposed to be answered? Or are you guys obligated to answer that? Okay, we're allowed, but not obligated. Okay, so my question is why have there been so much stuff stated, proof, evidence, the fact that nobody asked for this woman that just said blankly, I got the evidence that Warden Harper is lying about what he's doing, what's going on in the jail, and then you're shaking your head, but during this whole thing, all these people, everybody you got all these sheriffs here got a personal guard for the warden, like everybody shaking their heads, putting their thirst, gotta snap their fingers because we're so tired. My baby, right there, my baby, I fear for him. I feel for everybody's babies. Because of you guys. I just don't understand at this point why y'all make this meeting public. Who is this meeting for? Who is this meeting for? It's not for the people in the jail, which they've been blowing up my phone since I got here. Literally, jail call after jail call. Call me yet. It's so saddening that they just hung up and they're going to call back in 10 minutes and they're not going to get the chance to say what's really going on. But me, I just got out. I was in the Allegheny County Jail on, Sunday? I swallowed a necklace in front of 3 medical staff and a sergeant, which they watched me swallow it because I said to them, I'm not going to die here. I was sat in a cell with a button that didn't work purposely. I was told, file a lawsuit because of who I am. So not only did I not get to go post bail and go straight to my child, but I had to go seek medical attention after leaving the Allegheny County Jail, which brings up, I think someone said, just because they discharge someone from the jail doesn't mean they're not responsible for the death or the injuries of that person. So what are you guys here for again? Nothing has happened. Sergeant Tucker, the person that, was on video on WPXI pushing me in the elevator and me being tased multiple times and me being put in a restraint chair, she still works there. She still works there. So what are you guys here for?
Thank you. That's your time.
Yeah. What are you guys here for? Can you answer that, sir?
We don't answer public comments. Thank you for your comments.
You're pathetic.
Thank you.
Pathetic.
We'll now
The
hear
only
from-
person that deserves to be up there is Bethany because she fights the hardest.
Of course. We'll now hear from Brian England.
Now I'm gonna talk my shit, 'cause now
Man, that's a tough act to follow right there. Englert, first name Brian. I'm president of the Correctional Officers Union at the jail. I'd just like to go on the record and state the correct staffing numbers. There are 358 full-time officers at the jail right now. 9 are cadets. 336 of them are actively on the schedule. 8 of the 29 officers hired since January have resigned. 1 has been terminated. None of them have been given exit interviews. What is the process to ensure that they get one? I emailed everybody on the board. An officer of 17 years that resigned, he wants an exit interview. I gave all of you his cell phone number, except for you, Steve, because it should be Rich Fitzgerald. We also still have a second officer on Unit 5F, which is mental health. Per the warden, he and Judge Lazara felt it was unnecessary. I just spoke with Judge Lazara. She said that wasn't true. We are seeing mental health inmates with recent histories of almost 100% of their time on mental health units being crammed down to general population. And we can't figure out why. We have 3 mental health pods, and they're being crammed down to our population. I believe, Bethany, you spoke to one who obviously has mental health issues. He's talked to you about his lizard forever and how he hates his mother. I mean, I don't want to go into his name or his history, but he has been mental health almost every stay. Uniforms, this is our last month to use our voucher with our terrible vendor. We show up to the store. There's nobody in the store. There's not one customer. They won't let us in to get a uniform. We need an appointment. We try to buy the uniforms online. It says the vendor's not approved. Steve, I emailed you about this, like most of my emails to you. They come back unanswered. And lastly, the one other thing I want to say is around morale, there is no morale. Once a week or once a month, an employee gets a morale award. It's a staffing bag full of chips and candy, probably from commissary. It's already overpriced. There is no morale for all the officers in the building. We are not recognized daily. There's nothing going on weekly. No kind of pizza or anything like that. It's just ridiculous when you talk about morale in that building when we have officers working 80 hours a week on overtime. One of the things we did request was that the warden bring back the police officer support team into the facility for the mental health of the officers there. I requested it to be on the lunch hours of all 3 shifts, maybe 1 week a month, because my officers need that, and I hope they take that seriously. I gave Chief Deputy Warden Beeson the card to call them, schedule them in the building. So, and also, I just want to say, on my part, all of my inmates have 2 blankets for sure. I do the laundry every week. I know they do. Bethany, you were there. You can attest to that. I'm not sure where the blanket thing is coming from, but we all make sure our inmates have blankets, at least the 2 that they're required. Thank you.
Thank you.
All right. We'll now hear from Bobby Linskins.
Hello, Bobby, B-O-B-B-I, Linskins, L-I-N-S-K-E-N-S. I want to say, I don't know much about this. I had never heard of this board or anything about the Allegheny County Jail and the things going on there until last night when I heard about these reports and bugs in food and just horrible conditions, and I had to come here and talk to you guys. I want to talk about many things. First of all, probably seems like one of the least important things, but as an avid reader myself, books are so important for people's mental health. And I heard that they need a receipt in the box or they can't get it. Why? What the hell is the point of that? What difference does it make if there's a piece of paper in the box? And you address this with Barnes & Noble and you're waiting to hear back from them? For how long? Why would Barnes & Noble do anything to help it? They're obviously getting money for products that they get back and they can resell to somebody else because there's no accountability for it. And then today, to hear about the man with intellectual disabilities that died in the prison, to hear the timeline of what happened to him, to have my own 4-year-old daughter who's autistic, and to think about she's going to be an adult someday. What if somebody treats her that way? I'm just very disappointed and disgusted at the things that I've heard here, and I'm especially disappointed and disgusted at the response to them. That's all I have.
Now hear from Kim Williams.
Kim Williams, KIMWILLIAMS. Work for APA. On the way down here, I was asked to read something that someone emailed to me. They don't want me to say their name. They're scared of retaliation, as other inmates are being retaliated against. So I'm going to go into reading, then I have a little something to say for myself. He says, "Please help. My name is Anthony Townsend. I am a victim of the illegal probation process, as well at the Allegheny County Jail. I'm currently still going through it as of right now. It's messing all I built up my life for. And they're just saying me and someone else had only an argument. That's why I'm being punished until court violating my innocence, until proven guilty, right, also." He said they said it's simple assault for arguing. He said he was just arguing. He was arrested. When the other person explained their way, admitting that he didn't argue, all he did was just leave. He said a report even says that in a police report, the police is a whole different story than what the so-called victim is suing for. He said, "This is bullcrap. It has messed up so much of my hard-built life." He said it's messing with his mental, because he worked hard. He said they just messed up all that about inaccurate arrest, which led to my illegal probation hearing, where even my high-paid lawyer, Mr. Rother, couldn't even defend me in the probation hearing because they didn't let him in there. He said I didn't even get the chance to talk with an attorney before the hearing. They just shoved me in there and said things that were not true, like I don't pay my fines. When are my fines being paid down and gone? I'm so sorry. I'm literally crying right now, because they even forced me to take a plea by keeping me in jail for something they still don't even know or can prove that I did, because I didn't stay in jail for over a year. On that also, and they forced me to take a COVID-19 test. I'm sorry, I'm just reading from what was sent to me. He said, Patrick Sweeney did an ineffective counsel. He said, which made me take the plea for something I didn't do just because somebody had a case on me. I swear it would prove the case in investigating. That's the whole reason I'm on probation with the judge, because I was forced to take a plea for something. He said that was illegal probation. He said, please help me. I'm really hurt to the court, because you will see I'm being violated along with my rights for a while. He said, I don't know what the problem is, but they're not being right.
Chairman, if I might, you actually exceeded your time. You said you were something else you wanted to say.
Oh, yes, there was, this is my second board hearing. And to see that, I mean, it looked like a clown show for real, like the young man was saying. That the only persons that really act like they care of what's going on with the families, the victims, is 3 people. We already know this: Bethany, Mr. O'Connor, and this other lady right here. Okay. And before the attitudes, we have the policeman that's really, has his gun, his hand next to his gun. He's mad because there's people that's testifying here. he's really guarding the warden. I keep hearing all over and over and over again, we're going to do this next time. This court hearing will be here. We'll bring the evidence next time. I don't hear anything. This is my second time here. Everything the last time y'all said y'all was going to bring, you didn't even bring. When are you going to bring it to the table? When is he going to be held accountable for what's going down at the jail? When is people going to stop dying? Because enough is enough, they're dying. And nobody even says sorry. And the attitude that you had, the blatant attitude that you have, that you bring to this right here, is I don't give a damn. Accountability, make it happen, and punish people for books. I can bet you right now somebody's being retaliated against. They're getting books taken away from them. The only thing that cures their mental health is a book. You're taking away from them. Come on, warden. You got to go.
Public comment from, I believe it's Nadia Nerner. I'm sorry, I can't read the last name. I apologize.
Oh, we can't do it.
Okay, you good?
Hi, I'm Nadia. I'm a community organizer with Cadby West. Oh, my name is Nadia Narnor. So I work for Cadby West and Take Action Advocacy Group. And I am here to basically reiterate the same things everyone's been saying. There's been a dereliction of duty here. There's been an abandonment, and excuse me, I'm speaking. Hi, I really did want to talk about the disrespect we're getting from you all, so this is perfect. Because the possible outbursts that you all are talking about are not because we're difficult people. I have 2 jobs, and I'm here waiting for 7:45 to speak, right? I have 2 jobs, and this is your job, and I'm here waiting to speak, right? And you're speaking during me, so I do not appreciate that. I think it's clear that you all don't care about respecting us and that you treat us as difficult when I don't think you understand the pain this community feels. It's literal pain. It's literal agony. And all you can say is your time is up. That's disrespectful. I want you to feel that to your core, and I want Rich Fitzgerald to feel that to his core every time I see him walking down the steps to leave the building while I come to this meeting. The security's behavior today was also interesting because this is a public meeting, and the public's literally using these meetings to express our concerns, and instead it's, oh, the public's going to cause a disturbance with blankets. That's what security said. That is ridiculous. Because again, you all serve us. We do not serve you. Why is this behavior the same behavior that's been going on for 3 years? I've watched probation detainer hearings for a year straight, and what has changed? Nothing. I know what's going on. I serve the people that you're incarcerating. That's what I do for a living with 2 jobs. So can you do your 1 job here and not make me wait till 8 p.m. to speak? Maybe you should change the schedule. I'm tired of being disrespected by this board. I'm tired of incarcerated people being disrespected, and I'm tired of people talking about frustration when that is not even close to what we are feeling. Not even close. A man had his humerus broken. I heard other people reporting straight to me that they watch people get handcuffed naked and beat. That has not happened just once. It's multiple times. And I listen to these people every day. I'm the one talking to them. So I would appreciate it if people who get paid more than me do their jobs.
We'll now hear from Luke Watkins.
Hi, my name is Luke Watkins, Lukewatkins. I'm unaffiliated. I'll try to be quick, and I'm directing this question to Councilperson Hallam because it seems like she is the only person that answers anybody. You said that the board has a statutory requirement to do what you said. Where do they draw that power from?
It's Title 61. It's a Pennsylvania state statute. We're allowed to. It's Title 61. You can look it up, or if you want to give me your email.
Chapter 17?
Yes.
Okay.
Yeah.
Thank you. So I'm just going to read Section B of Chapter 1723, Composition. The board shall be composed of the board, you guys, the county chief executive, the two judges of the Court of Common Pleas, one of whom shall be the president judge, or his designee, who shall be a judge, and one judge appointed by the president judge, the county sheriff, the county controller, the president of county council, or his designee, 3 citizen members as provided in subsection C. So for 2 of the 6 of the series, they are explicitly given the power to give designees. The other 4 of the 6 are not. And obviously, Judge Housie, you're not going to answer this question, but are you aware of any statutory interpretation which would imply that if in a subsection of a series of lists, when 2 are expressly given a power and 4 are not, that power extends to the rest? So I just want to say that you are legally not allowed to be here, Mr. Pilarski.
There were a number of presentations that were going to be done regarding the jail visits, but given the late hour, we are going to table those until the next meeting. So with that being said,
I'd like to make a motion to adjourn.
so moved. Meeting's adjourned.